We are student-assisted medical and dental applications, a society at Barts and The London School of Medicine and Dentistry, but you can call us SAMDA. As a society, we are dedicated to support schools, colleges, and sixth form students in their first step towards a career in medicine or dentistry. We conduct school visits to give you that personal guidance, Clinicians Evenings with prestige alumni and professionals, skills days to equip you with all the skills to ace the application, mock interviews with students and clinicians to give you that first-hand experience and get you ahead of the game, a buddy scheme so that we at SAMDA can support you every single step of the way, weekly tips on our social media to give you some bite-sized and concise wisdom and advice. If that's not all, our extensive SAMDA medicine and dentistry guide and much, much more. Check out our social media and stay up to date. We are only a click away.
Hello everyone, my name is Madhura and I'm a fourth year medical student at Barts and The London.
Hi, I'm Abisha and I'm a second year JEP at Barts and The London.
We will be your hosts for today's virtual Clinicians Evening, where we will be joined by doctors, dentists and alumni who will be talking about their experiences in medicine and dentistry. We'd like to extend a warm welcome to everyone that has joined us today. We hope you're all keeping well and staying safe.
This event is open to everyone, so please do share the YouTube live stream link to anyone who you think will benefit. Also, you will receive a certificate of attendance at the end of this event. And you might have already watched the video that we just showed, which summarised the widening participation work that SAMDA does, but Mother will now go into a little bit more detail about who we are and what exactly that we do.
Okay, so SAMDA stands for Student Assisted Medical and Dental Applications. We're a widening participation society at Barts and The London, and as the name suggests, we help highly motivated sixth form students from local state schools towards a career in medicine and dentistry. So as a widening participation group, we focus our efforts in levelling the playing field. We do this by providing free access to resources and events that help with personal statements, interviews, and entrance exams. This year, of course, our activities are running virtually across our YouTube and Instagram, so make sure to subscribe and also follow our Instagram to keep up to date with all of our activities. I'm now going to hand over to Abisha to talk about safeguarding measures.
Thank you, Mother. So because we have some under 18s in our audience, we are limiting interaction by turning off the YouTube comments and the live chat. Having said this, you'll be able to interact and ask our speakers questions in the live Q&As by submitting questions to our Instagram story. I'll have a bit more about this in the next slide. Of course, all participant information will be kept confidential. However, when you submit a question, make sure you don't put any personal information or any inappropriate language in those questions. In terms of reporting any inappropriate activity, please email us about this with your school teacher CC'd in, and we will escalate it as necessary. If you have any general questions that are not specific to the Q&A, but instead are about SAMDA events or anything else about the application process, again, you can email us at our SAMDA email with your teacher CC'd in, and we'll happily answer any questions that you might have. Right, so how can you ask questions for today's event? There will be a live Q&A at the end of the event and in the middle of it as well. So in order to submit questions for those Q&As, head over to our Instagram. Our handle is @Bart_SAMDA. On our story, there's a post that basically looks like the one on this slide, and you can type in questions throughout the event. We will have like 3 Q&As, one for dentistry, one for medicine, and one for the UCAS process. So feel free to ask questions throughout the event.
Okay, so here is our itinerary for today. As you can see, we have talks and live Q&As from various clinicians. So do take a picture. You can stay for the entire length of the live stream, or you can tune in for talks that you're interested in. Having said this, we believe that aspiring dentists would still benefit from listening to medical professionals and vice versa. Maybe it will help you decide if you're unsure between the two career pathways, or it could help you answer a very commonly asked interview question, why medicine, not dentistry, or vice versa, or any other healthcare degree. So there's definitely gems in every talk today, so we hope that you're looking forward to listening to our speakers and absorbing any words of wisdom. So, before introducing our first speaker, we'd like to bring your attention to our personal statement prize draw. The winners of this prize draw will have a draft of their personal statement reviewed with personalized feedback by one of our clinicians. Of course, it's still early days, so it is completely normal if you don't yet have a draft. Therefore, this prize will be valid until September. So do future you a favor and enter the prize draw. It will definitely come in handy when those deadlines come rolling around. So in order to enter the prize draw, give us a follow, like and share this post, and tag 3 other people. We understand some of you have private accounts, so if you just send us a screenshot of you sharing it, that's fine. This post can be found on our Instagram under the handle @Barts_SAMDA. The giveaway will end on Thursday, the 15th of July at 10 p.m, so it's definitely not too late to enter. We will announce the winners the next day, so Friday morning on our story, so keep your eyes peeled for that.
Thank you. So our first speaker for this evening is Dr. Zamin Kesvani. He's a recent graduate from Barts and The London's dental school. During his time at the dental school, he was a SAMDA dental representative. And today he's going to be talking to you a little bit more about his experiences in dental school.
All right, so hey guys, just gonna share my screen. All right, cool. Okay, so hey, so my name is Zamin. I recently graduated from Barts just this year, so only about last week or so. But today I'm going to speak to you a little bit about what it's like to be a dental student here at Barts, or just in general anyway. But before we get started, just something on Menti for you guys. Okay, so if you can go to menti.com and input that code, and you'll find 2 questions there for you. See you in a bit. Okay, so we got a couple people, dentistry, all right, medicine. Okay, we're coming up. Okay, sounds good. All right, so we've got 11 people tuning in so far. It's growing. Okay, sounds good. 18, oh, medicine. Okay, fair enough. Okay, yeah, that's expected. Okay, so I think most people have submitted their pieces. Okay, so mainly medics we're finding. All right, so there should be a second question as well. If you head over to that, just want you guys to input what comes to your mind when you think of university. It can be anything. Try to keep it PC, guys, please. As we know, there are under 18s on the call, so all right, competitive. Independence, okay. Yeah, I agree with both of them, to be honest. It can be quite daunting as well. Courses, yeah, there are so many to choose from, right? Difficult. Degrees, what does that one say? Hard work, okay. Okay, so the main theme seems to be it's difficult to get into, apparently. I'll shed some light on that, so okay. Oxford and Cambridge, okay, fair enough. A couple of people were applying for Oxbridge. Okay, sounds good. All right, so that gives me a rough idea as to what you guys are thinking. So burnout, that's a good one. All right, so let's get back to the presentation. And all right, so a couple of you mentioned burnout, and finding it difficult to apply to. I was there 5 years ago. It's crazy to say, but to be honest, it is daunting, and there are so many courses to choose from. The fact that you also get 5 courses, I'll touch on that as well. But hopefully, after this sort of evening in general and my talk, you'll have an idea as to what's good for you. All right, so bits about me. So I graduated, as I mentioned, last week, in fact. So graduation's next week, I think, actually. But outside of dentistry, I don't know, really. It's mainly sports, chilling with friends and family, just any uni student, to be honest. So the main thing about uni, a lot of people mentioned independence, right? The good thing about uni is you can find friends who have like-minded interests to yourself. So it's your sort of time to find yourself and sort of more develop as a person in general. I grew up in Watford. GCSEs, the 6 that you had to do, maths, science, English, as well as history, French, Latin, and RS. And then for A-levels, so the GCSEs that you guys do, it doesn't really matter what you tend to do, as long as you have the ones that your school or college will let you study A-levels for. So in terms of A-levels, I believe you guys will need chemistry as a minimum, and I think you'll need 2 other sciences. So you can do maths and biology. So back when I did it, I did maths, bio, chem, and then my 4th one was economics. But I think many of you guys don't end up doing a 4th one. I then also went and did an EPQ. So to be honest, I don't know if I'd recommend doing one. In my application, when I sort of submitted my application, I thought it may give me something to think about and talk about in my interviews. But only one university asked me about it, and it was only because I brought it up myself. It didn't really come up in, I can't say which unis brought it up and which didn't. Unfortunately, I'm not allowed to say that. But in terms of doing an EPQ, the advantages are that you find out more about a topic that you might be interested in. So I'd recommend doing it related to the course that you want to study. But at the end of the day, it's not a necessity, right? No one's going to put it in their offers for your university place. So it's completely up to you. So if you feel that it's going to be too much work for you, which I personally did, I don't think it's probably the best idea. But that's up to you completely. So where did I apply? So there are 14 dental schools in England, I believe, across the UK. And I went for QM, I went for Barts, QM, King's, Plymouth, and Cardiff. And then my 5th choice, which I'll talk about in a second, was also at QM. But yeah, to be honest, with universities, mainly it's about the feeling that you get. So for the open days, I only went to a couple, and the rest of them, I think I applied blindly, which I don't know if I'd recommend. But yeah, it's mainly for where you want to get the feel for. And then the UK CAT, to be honest, some unis differ in terms of looking at UK CAT. Leeds looks at BMAT, for example, for dentistry. For medicine, of course, it depends on the uni. But the score, to be honest, sometimes they have a cutoff. So I recommend just calling the uni or emailing them. They'll probably be happy to help you out, but it depends on the uni, right? In terms of offers, I actually had 3 interviews and 3 offers. So I had Cardiff, Barts, and had Plymouth. The interviews are very different. So if you find that you're someone who MMI might suit, so MMI is multiple mini interviews, right? So you're in a circuit and each interview is with one person and then you rotate round. So if you mess up one interview, you can still pull it back on another because that person is not going to know how you did. So if you feel that that style would suit you, it might be worth thinking about that. The other style is traditional. So my Barts interview was a traditional style interview. To be honest, the main thing about interviews is just being confident, knowing your stuff, knowing your personal statement, and to be honest, just tell the truth. The interviews, to be honest, I enjoyed a lot of them. So Cardiff was my favorite. It was really fun, and it was based on quizzes and just getting you to think laterally, and it was just quite fun and enjoyable. And the question everyone is asking, why dentistry? So you have 5 choices, right? So some people, the reason I've talked about alternative routes is some people decide to go for some dentistry, some medicine, and then a 5th one being completely random. So mine was biochem, but in reality, I wasn't ever going to choose my 5th choice. So I chose dentistry based on my work experience. So I'd recommend everyone go and have some work experience in what they want to do. So I narrowed my university choices down to 4. The other 3 I didn't end up having work experience in, but dentistry, what I did have work experience in, I loved it. So that's how I arrived at my decision. So I saw things that, I found really enjoyable. The fact that people would interact with the clinicians in quite a friendly manner. And it's something that you can just help people with their lives. For example, a lot of people came in complaining of different things, and you get to make a difference. Same with medicine as well, but it depends, what you prefer. In terms of alternative routes, some people may want to, so for example, we have some people on the SAMDA committee who are JEPs. So that's the graduate program, right? So some people decide to do an undergraduate degree. They then decide, okay, maybe I want to go into medicine, or I want to go into dentistry, and they may choose to go in like that. If you do, the grades you require are slightly different. So again, call the unis or email the unis, specifically to where you want to go. Some people, a couple of my friends did this actually. They chose, for example, Chem Eng or economics. And so for some of these unis, you may have to submit a separate personal statement. So if you are considering, branching out and not just applying for all 4 options as dentistry or medicine, then if you want to submit something else, you may have to do another personal statement. So just think about that. And of course, that's a lot of time and energy, but not all unis would do that. So, just contact the uni specifically. I'll be saying that a lot tonight. Okay, so life at Barts. That's background pictures of, a group of friends and I went skydiving for charity. That's the Barts emblem. But in terms of freshers and societies, it's your choice completely. So university, people mentioned independence, right? You can choose where you want to go. The thing is, at Barts, you have the societies at QM down the road, which is only in Mile End, and the societies here at Whitechapel. So the fact that you have access to both campuses means you've got a lot of societies to choose from. Personally, I didn't actually go to many. I went to society events in first year, but after that, to be honest, I preferred to spend more of my time just chilling with friends and, just going out wherever. London's a great city at the end of the day. One thing that you guys may not know about, though, is protected time. So Wednesday afternoons is sort of protected in the sense that lectures and things will finish by about 12:30 or midday, and you'll have the rest of the afternoon and evening to do, whatever event you'd like to take part in. So many societies have their main things, like football, for example. I used to be part of the football society. They had their matches on Wednesday afternoons. So there are also things that, like the student union, there's so many things you can get involved with. But that's in terms of freshers and societies. In terms of preclinical, you have what I'd say are 1 or 2 preclinical years. So that's before you mainly start, going into clinics full time, which is about, 4 days a week or so, 5 days a week. They may not be whole days, they may just be half days, but you're still in uni. The preclinical years, sometimes you're studying subjects which you may not think are 100% necessary, but what they're doing is they're teaching you skills that you'd apply later down the line. And things like biochemistry or neuroscience that I studied back in first year, there were things that were related to when we, moved up in higher years. And then teaching style, to be honest, when you're in the younger years, it's mainly lecture-based, and some PBLs, which are problem-based learning. So some of you may know about it, some of you may not. Essentially, you're given a scenario and you have to research different aspects of it and sort of produce not only a report, but also a presentation, which you can complete and submit as a group, or sometimes it's your own one as well, if that makes sense. But I quite enjoyed that. So it's getting you to think specifically about something clinical, and it sort of, because there's such a range of topics that they choose from, you're exposed to many sorts of different topics before you enter clinics, which is quite helpful because you've gained sort of background knowledge into that. In terms of what I prefer, I've already said it, I'd probably say PBLs. Lectures, some people do prefer it, but you don't really get to engage as much with the lecturer because someone's just talking at you. So it's very much different to school because, you're putting your hand up, you're answering questions. You can ask questions at the end of the lecture, and they will do their best to answer them. But PBL sort of puts a different spin on it. And if you like group learning, then that, may be something that you'd prefer. In terms of the exams, though, they're very different. So gateways are something specific for dentistry. So before you are allowed to treat a patient with a specific, treatment option, you have to pass an exam that shows that you're competent and that you're able to do so. So they're practical exams. So I think in second year, I had a couple, and in third year, I had the most. But then once you pass them, you're free to go into clinics and sort of, do what you do, really. Written exams, standard, they're in school as well. The only difference is when you get to fourth year and fifth year, the written exams are more based on scenarios, like they're basically mini PBLs, I'd say, and they're structured small sorts of answer questions. So some of the questions will be worth about 4 or 5 marks, and they'd give you a scenario. You then have to use your clinical knowledge and apply it to the scenario. So it's basically like a mini PBL, but in an exam. OSCEs are something you guys may or may not have heard of. These are basically circuits, like an MMI that I spoke about earlier, but the OSCEs are where you can perform a certain task in sort of a circuit. So for example, you might have to explain to a patient that they have a particular diagnosis. You might have to break some bad news with actors, for example, or you might have to do something practical. Of course, it won't be like the gateway, so it won't be a full-on treatment. It may just be something small, but it's something that many of you guys may not have heard of. So that's just something different. And that applies for medicine as well. So you have to, all these different tasks, and it's in maybe like an hour circuit. So once that exam is done, it's done. There's no, nothing written. It's just in person. And then vivas. So I believe that these are for dentists only. I don't think medical students have these, but the vivas are basically kind of like a PBL again. I think there's a recurring theme, to be honest, but essentially you're given a patient case, and you then have to talk to the tutors that are testing you about what you would do. So they would then ask you questions. You have to explain your reasoning. These are the exams that mainly older years would do. So gateways, written exams, and OSCEs would be for all the years across the board. Vivas will mainly be for fourth year and fifth year. I think they're also introducing it for third years as well. But to be honest, it was so long ago that I can't really remember mine. But yeah. By the way, if you guys have any questions, I know there's a lot being covered. So if you do have any questions, then do message on the SAMDA chat. I think it's Barts SAMDA _SAMDA. I think they posted it. But yeah, I'll then have those come through to me, and I'll answer those at the end. Okay, so in the previous slide, I spoke about student life, what uni's like. Here, the 3 pictures that I presented are the 3 clinics that you'll be at. So the main one on the right-hand side of the screen is the Royal London Hospital. It's one of the biggest in the UK. It's huge, but you'll spend most of your time there. Again, specifically dentistry, by the way, if you haven't figured that out yet. But the Ludwig Gutmann on the far left of the screen, that's a really cool building. You can see the shape of it. It's quite new. I don't know when it was built, but that is mainly for pediatric dentistry. You do treat some adults there, but mainly I spent my time there for peds. And then the one in the middle is Barkentine, so that's in Canary Wharf. So you're situated either between Whitechapel, Stratford on the left, and in the middle in Canary Wharf. So you're in quite nice areas of London. To be honest, Whitechapel is probably my favorite one. It's the most, it's got the newest equipment, and all the staff across the board are really friendly. But it's where you'll spend most of your time. So I guess I just grew a liking to it, really. Then I've also touched on clinical groups. So clinical groups, essentially in first year, you'll be placed in groups of 9 or 10. You'll spend most of your time with them when you get into the clinical years, because when you're situated on clinics, you'll be matched up with them. You also have a partner who will, you'll nurse for each other. And, while I'm treating, my partner would nurse me. While she's treating, I would nurse for her. So you sort of buddy up, you could say, and you move together through the 5 years. And it's actually quite nice. I've got a picture of my clinical group coming up in a second, actually. And you just gain a really close attachment to them. Yeah, it's quite a friendly atmosphere, really. And changes due to COVID. So I know that our year was heavily hit by COVID. The thing is, because we're in London, we are part of a trust, which means the decisions that sort of happen are, from the higher ups, if that makes sense. And our clinical time was sort of slashed quite a lot because COVID hit London really badly, right? In terms of you guys, though, to be honest, I don't know if it will affect you guys. I think the year below us, they're learning what works and what doesn't with our year. And then with the year below, I think they'll carry on a lot of the themes, which will be really good for them. But I think it'll basically fizzle out by the time you guys get there. So there's going to be a backtrack, because right now we were prioritized above the 4th years, but then they'll be prioritized above the 3rd years. But by then, when they're in 5th year, but by then everything would have fizzled out. So to be honest, don't worry about too much, how COVID's going to affect you guys. just enjoy it, to be honest. That's my advice. That's my clinical group, as I mentioned. And in the bottom, there's a picture of my friends and I when we collected our badges, when we passed our exams last week. But yeah, this slide is sort of something that I thought might help you guys in the sense that what advice would I have wanted back in the day when I was applying 5 years ago? So in terms of grades and offers, there are a lot of people who told me that, achieving the offer is harder than achieving the grades. Personally, I found it the other way around. I thought that I had to put a lot more work in to get the grade rather than the offer, because I think Barts is now A-star AA. When I did it, it was straight A's. King's as well as A-star AA. I think most of the other unis in the country are all A's, but personally, I found that more difficult to get than the offer. So in terms of personal statement, that's not really what this talk is about. And SAMDA has other events which you guys can tune into. So definitely do get involved with that. They also have their, prize draw right now. So you guys can still enter that to win an edited personal statement sort of prize draw, if that makes sense. In terms of the actual interview, so let's say you submitted your personal statement. Let's say you have your interview coming up. The interviews are mainly about just knowing what you've talked about in your personal statement, being confident in what you do and what you know, and just showing them why you want it and why you sort of deserve it. So if you lie your way through it, if you cheat your way through it, they're going to catch you out. You're not being honest. This whole degree, medicine, dentistry, it's all about being honest and, having integrity to work with patients and do the best you can to help them, right? So they can easily spot it out. People that interview have been doing this for years. I've sat on the interviews before, and we're not there to sort of catch you out when I was on the panels. So they're quite fun and enjoyable. It's basically like a chat, whether it's MMI, whether it's a panel interview. Think of it just like an informal conversation of them wanting to get to know you. Because when you get to the interview stage, everything is wiped clean, which I didn't know. So you're all on level playing field. Once you get an interview, it doesn't matter if someone has, the best experience in the world. If they can't talk about it properly, and if they can't say that they've learned anything from it, then that won't be of any benefit. So you want to show them that, you've taken things on board, you've had work experience, you've learned things from it. You can then apply this to your life when you're sort of an undergraduate student. And yeah, I found that bit a lot easier than the grade. Obviously, you guys have to study quite a bit. I know I did. So that's something specific for some people. But if, that's, I'm not going to talk too much about it, to be honest. I think I already have. I'll just repeat myself. But yeah, in terms of the degree itself, it's very different to Friends. So no one actually told me how different it would be. But you're in uni for half a decade. People will come and leave and they'll graduate within 3 years. And then suddenly you're just there like, oh, wait, all my school friends are graduated. I've still got 2 more years left. It's really long and it is very tiring. So it's very different in that sense. As well as contact hours, there are some university courses that I'm not going to start slating things off, but there are some people that they might only be in uni for like 10 hours or 5 hours a week. Our course is at least 25, 30 hours. It's kind of like in some weeks, it feels like you're doing a full-time job, but you're a student. So it is very different and it can be very intense. Having said that, I think this year, COVID-wise, was probably the most intense year that I've ever had. I don't think the other years were this bad, to be honest. I say that as if it was a nightmare, but it wasn't. You get through it, which is good. But yeah, in terms of exams and coursework, other courses will have a lot of coursework and, you might have to submit quite a few pieces. A dissertation, for example. Dentistry, I don't know about medicine, but dentistry doesn't have that. So the only long essay that we had to submit was, I think, first year and third year, where you just had a couple of essays to submit, mainly, I think, about 2,500 words, which is nothing compared to like a 20,000 word dissertation, which is, I don't know how many pages long. So that's beneficial, in my opinion. And then in terms of exams, which I spoke about, other courses won't have vivas, they won't have OSCEs, they won't have, exams where you may have to engage with an actor. So that's quite different. And then in terms of holidays, the first year holiday at Barts was quite long. It was, I think, 3 months long, so longer than school holidays. But once you go past first year, the holidays, summer holidays particularly, are around 4 weeks. So you don't get much time off, in which case most people just want to, get their energy back before the next year comes. So that's one thing in terms of holidays, whereas your school friends will be off for like 8 weeks or so. And in terms of actually starting the degree, I think I started in September of when I finished A-levels. Most other courses start in October, November. So you even start earlier. So there is quite a bit of difference in terms of that. The other thing is, I've already mentioned it before, but it isn't a breeze. You can't come into a course like dentistry. You can't come into a course like medicine thinking, oh, I'm just going to fly through. It's going to be easy. It's definitely not. And I think anyone who says that to you, I would question it. I think it definitely does push you to the limits at times. You find sometimes that, you're demotivated, you're tired, you just want to go home and have some mom's food or something. But I think definitely ask yourself, why do you want to do it? I think if you're coming into it thinking it's going to be easy, it's definitely not. So if that's what you're thinking, that you're just going to get, a job that comes with a good title and you want to just do it for the money and all these different aspects, I think you definitely need to reconsider it, because there are plenty of other degrees where you can have that outcome without having to put as much energy into it. But what I can say is, if you do want it, and if you do think that this is for you, it's really rewarding. I think dental school has probably been the best thing of my life. In fact, my friends and I, we're all going to miss, spending time in clinics. This is my clinical group in the background. So I'm there. And then my friends are all there, mainly girls, but yeah, anyway. But yeah, where was I? I think definitely ask yourself why you want to do it. If you do want to do it for the right reasons, then 100% I'd recommend it. It's, you work with patients, you get to make a difference in their lives. And seeing that as a student just made me realize sort of I chose this for the right reason. So it's quite nice in that sense. And time, emotion, and energy input, I've already mentioned that. So it's not a breeze. And I'd just say, don't hold yourself back. I think the way I've spoken about it makes it seem like it's a nightmare. It's definitely not. And it is doable. But just know that if you want anything in life, you have to put the shift in. And I think there were people that sort of said, okay, don't do this. It's a really intense course. But you make that decision for yourself and you take it in your stride. And I think if you're willing to take on a challenge, it's really fun. So definitely do it. But yeah, I think that's it. So I've just asked you guys if you have any questions, and I'm wondering how I'm doing for time. So I've prepared something else on the next slide, but if you guys have any questions whatsoever about student life, about applications, I can't really answer because it's specific for the university. I can't talk about the interviews, but if there's anything that I can answer, I will let you know. There is also a talk by Dr. Berry, so he's the one who actually interviewed me. So he's up after me, but yeah, I'll just check if there are any questions from you guys. Okay. So, okay, a couple of questions coming through. Let's see. All right, so the first one that we got through is, what's the most rewarding part of being a clinician? I think there's so many things. I think, to be honest, one case that I treated when I was in third year, I believe. So this was at Gutman, this was in Stratford. So this was an adult case. There was a patient I had who didn't have any teeth. So this was a complete denture case. So I was making all teeth prosthetically. He was on and off with dentures, for top and bottom arch. He was on and off for years. He didn't have a pair that he liked. And it took a while. Complete dentures are not easy, but I was working under a specialist who helped me a lot. And one thing I'd say about Barts, in fact, all dental schools, you'll work with specialists that will really broaden your horizons. So that's really beneficial. But that case specifically, the patient was really happy and he just couldn't believe it. He had a pair of dentures that resembled him when he was younger. So we got him to bring in a photo and we sort of tried to replicate, I should say, the position of his teeth and where they were from before he lost his teeth. And he mentioned one time that his family even made a comment saying that they looked really natural and how they did when he was younger. But yeah, that's why I'd say it's the most rewarding.
Sorry, can I quickly interrupt? We will have a dental Q&A with you and Dr. Berry literally in like 20
Okay,
minutes.
cool. Yeah, all right, fine. So let me know, which one, should I go to the case or should I go on and answer questions?
We can do the questions later. If you
Okay, cool. Let's do that. Yeah. Let's do that then. Okay, cool. So let me share my screen again. Sorry, guys, bear with me.
Hi, this case sounds super interesting, but just because we're pressed for time, could we move on to Dr. Berry's talk?
Yeah, no worries.
You gave such a realistic insight into dental school. You didn't just talk about the highs, you also gave us the lows, giving our students a real realistic view.
No, sounds good. Yeah, that's all good. I hope that was beneficial, but again, I'll be in the background still. So yeah.
Okay, now let's move on.
Okay, moving on to our next speaker, we have Dr. Jason Berry. He's the head of admissions and recruitment for the School of Medicine and Dentistry and the director of undergraduate dental education. So today he's just going to be talking to us a bit more about a career in dentistry and kind of what that entails.
Okay. Good evening, everyone. Hopefully, let's get this right. Okay, so hopefully you can see that. Is everything okay? Can everyone see that?
Yeah, we can see and hear you. Brilliant. Okay,
brilliant. Okay, thank you very much indeed. SAMDA, thank you very much again to the committee for asking me to, hold on. I don't want that to happen. Thank you very much indeed for asking me to come and do this talk again. It's always an honor. Well done, Zamin. Yes, I interviewed Zamin over 5 years ago now, when he came to our dental school, and he's been an excellent student. And I have the pleasure, I've got the most fantastic job really, because as you can see from this slide, I'm head of admissions. So I see the students in, and also director of undergraduate dental education. So I monitor the students throughout, and then I see them at St. Paul's Cathedral for their graduation ceremony. Zamin is having his next Monday evening. So I've got a lovely job. I see the students coming in, I see them develop and become dentists, and see them out at St. Paul's. So it's lovely. Just a little warning, I've got a few bloody slides in my presentation, and at the end we've got a Menti quiz as well, because I'm trying to give you an insight into what it is like to be a dentist after you've done all the qualifications that Zamin has gone through. So as Zamin has quite rightly said, it's a very intense 5-year course. Loads of lectures, seminars, you've treated loads of different types of patients. You've also played hard. Zamin didn't really mention that very much, but you also have a really good time as a student as well. And then after you've qualified, you then go on and do what's called foundation training, an FT year, which is for 1 year in a general practice, which is located anywhere within the UK. And after you've done that 1 year, that is the time when you're going to sort of have to make some real decisions. Congratulations, you've got through that 5 years plus that final foundation training year. Now the decisions are down to you. So what is next? What can you do next with your BDS degree? Well, 85% of graduates will go into general practice. General practice is what the term that we use, when you go to see a dentist and have a checkup and have a filling or whatever. That is a general practitioner. They might be working under the NHS, or it might be a private dentist, or it might be a mixture of both of those. And the remaining 15% will either go into sort of like a hospital environment, might go into academia, might go into the community career as well, armed forces, or some might even go into research. There's a lot of options that are open to you. So let's talk about, first of all, general practice. Now, if you're going to be a dentist in general practice, You need to have a few skills. Hopefully in that first year, if you've done your foundation training, you would have sort of grown as a dentist. You've taken all those skills that you've learned as a student, and now you've put them into place. And you've developed your skills, you've developed your confidence as well. So you need to be a good team player because you are part of a team. You need to develop the skills to talk to all types of people, around you who come to see you. You also need to develop some business skills as well and management, because when you're in a general practice, either as what we call an associate, where you're working for someone, or if you own your own practice, in a way, you're a business person. So you have to develop management and business skills. You have to manage people. You have to be self-motivated as well. It's quite a demanding job, as Amin has sort of alluded to. So you've got to be self-motivated. You've got to get yourself out of bed to do the job. There'll be patients waiting for you at the practice. So, you just can't sort of lounge around and think, oh, I'm not going to bother coming in today. So team working, really, really important. You're part of a team. There's the dental receptionist, there's the dental nurses, the dental hygiene therapist, other fellow dentists as well. You work as a team. You help each other out. So that is why in your interview, we look for people who are good at team working. In general practice as well, every day is different. Different challenges come your way because you do not know what is going to walk in that door. Mrs. Bloggs is your next patient. 9 times out of 10, you know that person's coming in for a checkup or maybe coming in to have a filling done or an extraction done, but you don't know what's going to happen during that procedure. So you have to be prepared for all eventualities. And that is one of the great exciting things of being a general practitioner. For example, you might get this coming in on a Monday morning. They may well have been attacked or been in a car accident or fallen over, and they have come in presenting with a fractured front tooth. And they expect results. They want something done. And they're looking to you as a professional to sort them out. So you've got to be quick thinking. You've got to diagnose, come up with a treatment plan, talk this treatment plan through with the patient, and come out with a really good ending. Or the patient might be coming in with some old black fillings and they would like them replaced with some white fillings. There might also be some tooth decay there in any of those particular teeth. And you've got to be able to have that discussion with the patient about the advantages and disadvantages of taking black fillings out and replacing them with white fillings, the extent of the tooth decay which might be in that tooth and the potential complications that might arise from having this tooth treated. So, and also you've got to discuss at length as well the risks and benefits and also the costs. So you need to develop really good skills at talking to the general public. You might also be doing procedures like this, where a patient has a missing tooth and you've treatment planned them and you're going to put what we call an implant or a screw-in tooth. You can go off and you can do courses and do specialized training to be able to do this. It's a very, very high-tech part of dentistry, but nowadays this is becoming a norm in general practice. So most general dental practitioners now will have to be trained up on doing different procedures such as implants. You might also be presented with a patient such as this, a lovely, beautiful smile. But is it? Okay, because this young lady, and she was young, she's in her early 20s, she actually had a horse's hoof in her face when she was very young and knocked out the entire front teeth. So she had to be rebuilt in some form. And that's not a bad job, is it? Okay, so when a patient comes in, something might not be what it seems. Okay, this poor lady lost all her front teeth. That gold post there, which you can see, is holding this denture in place. It's got a little ball end on it, if you can see, which clips into the undersurface of the denture to sort of make it sort of firm. You got her out of trouble, let all the gums heal up, because they were severely traumatized following that accident. And then at a later date, she had implants done, the screw-in teeth, as you saw previously. So where will you work? Well, as you know, and if you've been to your dentist, you know their dentists work in all different locations. You might be in a very large house. You might be in purpose-built premises. Different scenarios, you might be on the high street. You might be in a retail park. You might be in Lakeside Shopping Centre, for example. Their dental practice is in all sorts of environments now. Each of these practices have their different assets. Some of them might be really funky, really high-tech, and you are nowadays finding that most general practices are really high-tech. Lots of computers, you know, lots of sort of different types of software, which you also have to sort of get adjusted to as well. Sometimes you might have a laboratory on site as well, which is really handy because any sort of lab work which needs to be done can be done on site. You can build up a good rapport with the technician rather than sending out your lab work to make crowns or dentures out to someone who you have little contact with. You also might work in a practice with a lovely view. This was a competition done by the British Dental Journal in 2014, where general dental practitioners had to send in photographs of where they work. And there were some cracking pictures. You know, this top left-hand side one, that's Hong Kong. Fancy working in a practice there where part of the waiting room was actually on a veranda overlooking the bay in Hong Kong. You got the top right one there is Camden Lock. The bottom left-hand one there is Wisbech in Norfolk. And then the bottom right-hand side one is a view in London. So, you know, you might not have a view like that. You might be overlooking the high street. I don't know, but there's some really lovely practices where you can work outside. So what are the good parts about being a general practitioner? Well, you have that ability to change people's appearances and therefore their life experience as well. Being a general dentist has its real pluses. I come from that background now. I now work in hospital. I'll come on to that in a moment. But, you know, you get to know people really well. Unlike a GP, your patients will come and see you probably every 6 months or even more regularly than that. You get to know them, you get to know the families, you get to know the kids. And if you stay in general practice for a period of time, you will see those kids grow up, and then you will see them bring their kids along. Okay, so you can become part of the community. You can also be your own boss. Okay, there's lots of technology now, especially now. So if you're a bit of a techno geek, then you're going to have lots of fun. There's unlimited training opportunities. You know, there's lots of courses that you need to go on to as well to sort of upskill. It's slightly quirky as well in the respect that nowadays it's not a 9-to-5 job. You will see practices, they're open in the evenings, they're open at the weekends, including Sundays as well. That is how life is going, okay? Indeed, there are also practices in London now which are open 24 hours of the day. And you also have lots of travel opportunities as well, depending on where you want to work. What's not so good about being a dentist in practice? Well, lots of paperwork, you know, government targets and things like that, all these things that you have to comply with. We are one of the most highly regulated industries now. You also have to manage your staff and also have to deal with patient expectations. Patients are very demanding nowadays. You know, they expect the best. They will not settle for second best. They want the best. They go onto social media and they see people with lovely teeth and they come in and they expect you to produce their teeth in the same way. Okay. However, you've got to be careful because, you know, it's so easy to become stuck in the same room with the same nurse and you become insular and don't get out there and enjoy your life. Dentistry can sometimes be all-consuming. It becomes part of your life and it becomes all of your life. You've got to be careful. You've got to have a good work-life balance. It's not particularly nice when people come in and say, oh, I hate the dentist. You know, it's not. You're a dentist. It's not nice hearing from people, oh, I hate the dentist. You have to win them over. Dentists are notorious for their posture, bad necks, bad backs and things like that. Hopefully with the students that we educate nowadays, we ensure that they do sit right and their posture is correct as they treat their patients. And finally, it is a stressful profession. There's no getting away with it. You are dealing with the public. You're working in a very small environment. You've got to get it right because you don't want litigation. So there's a lot of stress there as well, but it has its rewards. There's no doubt about that. One of the best bits about being a dentist is the flexibility of your career pathway. You might want to go off into practice and you upskill yourself and become more competent and confident as a dentist, and then you might then want to change direction. So there's a lot of other options that you can do within dentistry as well, and I'm going to quickly mention some of those too. So there are alternatives to general practice. General practice is where you're going to start off, but you can go on to other things. For example, you might want to join the armed forces. This is really good. The dentists in the Royal Navy, the Army, and the RAF are well looked after. You can retire, I think, at 50 with a very, very good pension. Okay, and you work with very top equipment. You travel the world as well. So the armed forces is one way of changing your career direction. You might also want to specialize in something. Okay, there might be something that you like doing, really you love doing in dentistry. So you might want to become an orthodontist. That's the way you move teeth around, as you know. Pediatric dentistry, that's someone who deals with children. You've also got the restorative monospecialties, which I'll come on to in a moment. Okay, restorative means rebuilding. You could also specialize in oral pathology, oral medicine, oral radiology. There's also other things such as oral microbiology, oral surgery. Special care dentistry is worth a mention as well, and also the community services as well. So there's a whole host of other specialization pathways that you can follow. So for example, orthodontics, straightening of teeth. Okay, all of you know about orthodontics. Orthodontics is developing at a fast rate. The days of these metal bands is slowly going away, being replaced by these clear see-through aligners, which are used to move teeth. Oral surgery as well. Oral surgery is not only removal of teeth, but it might be major surgical procedures, such as the repositioning of the jaw to make the facial profile look better. You know, it might also involve in the hospital some real major operations, cancers of the mouth and things like that. Also, there might be sort of overlapping between the disciplines. Say, for example, here, this patient has got what's called a cleft palate and cleft lip. So this will then involve the skills of the oral surgeon to reposition the teeth, and also orthodontists to help finalize the position of the teeth as well. Now, I mentioned earlier about the restorative monospecialists. Okay, so you might want to train as a gum specialist. A gum specialist is called a periodontist. You might want to become a prosthodontist. That is someone who specializes in crowns, bridges, and dentures. You might want to just put implants in. That's an implantologist. Or you might want to be one of those people who specializes in doing root canal treatments. They are called endodontists. So there's lots of things that you can specialize in. You might also want to become a cosmetic dentist. Everyone, as we know, likes to have lovely white teeth now, all straight. So you might have to sort of go to a cosmetic dentist who will do a little bit of orthodontics, might do a little bit of bleaching as well. Now we've got wacky things that we can do now. We've got resin bonded bridges. These are bridges that we can replace teeth without actually having to cut the teeth down. Okay, so as you can see from these pictures here, you know, we've got a gap and we can actually stick a false tooth onto the adjacent tooth. We've got some fantastic glues such as Panavia, which is used in the aircraft industry to stick wings on airplanes. We now use these things in dentistry to stick teeth or false teeth onto adjacent teeth. Okay, we've also got extensive bridge work. Sometimes patients come in with lots of wobbly teeth. There's no hope for these teeth. Therefore, we have to take the bad teeth out, and then we can do what's called bridge work, which is like a row of false teeth which are stuck onto the remaining good teeth. As I mentioned earlier, special care dentistry, this is a real big and growing, expanding part of dentistry. Special care dentists, they cater for those people who cannot sort of be treated in the normal general practice environment. They might need a lot more time to get their treatment. They might need to be won over because either they're very, very nervous, or they might be taking medications which might impact on the routine care that they have. So that is special care dentistry. If you love kids, you might want to become a pediatric dentist. You have to be very patient. The treatment of a child is a lot different than being a dentist treating adults. Okay, so there are specialist pathways which you can train yourself up to become a children's dentist. Or you might want to become a pathologist. Unfortunately, the mouth is also an area where cancers can grow and other sort of disease conditions can manifest themselves. And sometimes with biopsies need to be taken, pieces have to be surgically removed by the oral surgeons and sent off to the oral pathologist to get a diagnosis so that further treatment can be done. You know, an oral pathologist, if you like looking down microscopes, an oral pathologist might be the way to go. And also you have the benefit that you don't have face-to-face contact with patients. So if you feel you don't like patients, then orthodontics might be the way to go. Or oral pathology might be the way to go. Also, have you thought about toothpaste that you use on a daily basis and all the materials that we use as well? These are researched and they're developed by dentists. At Barts and The London, we've got a massive research department. We have developed a lot of toothpaste. The most recent ones are called Biomin and Elsens. These are toothpastes which are going to become big market leaders in the future. And you can see there in the top right-hand side, they're pictures of the people who've actually developed this toothpaste. So research. We do a lot of research at Barts and The London, and we encourage our students to get involved too. As regards to research, we've got the Blizzard building, which is a lovely brand new building where all this research takes place. And as I said, we encourage our students to get involved with research. One of the things that you have to remember, though, whether you're doing dentistry or medicine, is that it's lifelong learning. Yes, you've done that 5 years of training. Yes, you've done that 1 year in general practice, but you've got to continually update yourself. We call this lifelong learning. So this means you have to go on courses. You have to update your skills, and you have to record these courses that you do, because the General Dental Council expect us to keep up to date. So my question to you is, are you up to it? As Zamin has mentioned, it's a very, very difficult course. There's a lot of fun on the way, but even after you've qualified, there are a lot of things that you've got to consider as well. You know, I'm coming to the twilight years of my career, and I can say, and I trained at Barts and The London, I have had a blast for time up to now. I have not regretted one single day of being a dentist. I have been in practice, I have been in hospital, and now I'm in teaching. So that gives you an example of a person who has sort of tried all different parts of dentistry, because that's what you can, and that's one of the benefits of being a dentist. So thank you very much indeed. It's been a pleasure talking to you, but now I think we've got a little quiz to share with you. So hopefully, so let's see if you have been listening, shall we? And then, okay, so what is a dentist specializing in root canal therapy called? Prosthodontist, endodontist, orthodontist, or periodontist? Can you remember? This is one of the specialist routes. Endodontist is the answer, okay? An endodontist. Okay, next question. So have a go at this one then. How long is that foundation training course after you qualify? Do you remember I say you go into practice? Is it 1 year, 2 years, 4 years, or 5 years? Okay, the correct answer is 1 year. Okay, there is talk about expanding it to 2 years. Hopefully that won't happen for you. I believe the medics have to do 2 years, but currently dentists only have to do 1 year. Okay, next question. What cement is used to fix those resin bonded bridges? Do you remember those resin bonded bridges where the false tooth is stuck onto a tooth next door as a special glue that we use, which is also used in the aircraft industry? Is it Pritt Stick, Gorilla Glue, Glue P2, or Panavia? Definitely Panavia, one of these very novel new cements, which is absolutely fantastic. Thank you. Okay. What toothpaste has been developed at QMUL? Was it Elsie? Was it Elsens? Was it Elicent? Or Eleva toothpaste? Elsens, absolutely. It was not Eleva toothpaste. Thank you. I think we've got one more question. Or am I wrong? Is there one more? Yeah. How long is a dentist training? Is it lifelong? Is it 5 years? Is it 10 years? Or is it 15? It is lifelong training, okay? The 5 years basic training gives you exactly that, basic training, okay? You've got to consider that dentistry is a lifelong journey. You will be forever upskilling, keeping up with the latest trends and the latest innovations that come your way. So if you want a course that you do 3 years or 5 years or whatever, and then you don't have to do any more studying thereafter, honestly, dentistry or medicine is not for you, okay? Both those courses, it is lifelong learning. Thank you very much indeed. It's been a pleasure as per usual. Hopefully that has been very useful. Thank you.
Thank you, Dr. Berry, for your insight into your career in dentistry. I thought it was really interesting that all the different pathways that were available. And there were some that I wasn't aware of myself. So
well, it's something Zamin's going to have to sort of decide at some point in time.
Okay, so we're just going to start with the Q&A now. We've got quite a few questions on Instagram actually, but I think the first one that I've got here is, what is you most or least looking forward to about working as a dentist?
Should I take this?
Yeah, I think that's aimed at you.
To be honest, friends, really, I think it's, you know, the next year is going to be 1 year where everyone goes their separate ways and you'll try and keep in touch. But I think the main thing is just keeping your head on it while you're sort of out there by yourself. You know, you've had 5 years where people have supported you along the way, and now you sort of have to find your own sorts of feet, if that makes sense. But, you know, definitely up for a challenge. So let's do it.
Brilliant, thank you. Kind of a similar question for Dr. Berry. What's the most rewarding part of being a clinician?
Oh, wow. Gosh, that is a far-reaching thing, that is. I like getting to know patients, and also there's nothing more rewarding than actually sort of having a patient who's really, really nervous, who needs treatment, needs a lot of difficult treatment, and actually gaining their confidence and their belief in you that you can do this treatment. And then in the final appointment, they turn around and say, "Thank you very much. You've changed my life." And believe me, that has happened on a number of occasions during my career. So that is just one aspect of I've got from being a dentist as well. But there's more to follow, honestly.
Okay, next question. How do you deal with the really intense workload?
Let me take this, Samin. You can pitch in. I think it's very, very important, that you have a work-life balance. You have got to separate your work life from your personal life, okay? So you've got to pursue all those hobbies that you've still got, so whether it be football, fishing, or whatever it may be. You must find time to have time out, okay? As we've mentioned already, it is a very stressful job. You need to walk away from demands of patients, demands of your staff, demands of being a dentist, and have downtime. Really, really important. And I think that is the most important thing to get across to new dentists, including Zamin, that, sometimes it's very, very easy to be sucked in to being a dentist, but you've got to have that boundary.
Yeah, I'd agree with that one.
Yeah, that's a really good point. I feel like that's generalized for everyone, regardless, medicine, dentistry, or otherwise.
Yeah.
Words of wisdom indeed. Moving on to our next question. Of course, we're talking about why dentistry is so great. But why do you decide not to do medicine or any other healthcare career or anything else?
Samin, what's your answer on that one?
To be honest, there are some people who would answer this question by slating off other degrees. I'm not going to do that because I think every degree has it due its own respect, right? I think what set it apart for me was the practical aspect. I've always sort of liked art and DT. I've never been good at it. I mean, I've developed while I was at dental school, but that's what set it apart for me, really. So yeah, whichever is right for you, I guess.
Well, I've got a very crass answer to that one, okay? It's really quite embarrassing, but I'll be very honest with you. I never even contemplated or considered medicine. It was always dentistry since about the age of 13. Purely, and this is the honest truth, my next door neighbor was a dentist, okay? He didn't have any kids. He sort of befriended me, came and played football with me. He was my hero. Okay, he had a little MG sports car, which I loved. He had a glamorous wife, who I think also had a bit on as well. Okay, and he gave me a summer holiday job in his practice every year, and I wanted to be like him. And that is purely why I got into dentistry. And that is the truth. I just fell into it, and I probably from the age of 13, never thought of anything else apart from being a dentist. And he obviously had a major influence on my life. That's made you all go quiet, hasn't it?
No, I really appreciate the candor. Why not? If you have a hero, and look at you now. You really followed. Yeah.
Okay, on the Instagram, there's been a few in the last few minutes. Have there been these situations that have made you cry, or is it terrifying when you get approached with a new problem? Like, how do you cope with a situation where something like that happens?
Dr. Barry?
Okay, I think, as you become more experienced and more confident, then you've got to think on your feet, because as I showed you in my slides, sometimes you do not know what's going to come into the room, okay? For example, sometimes the dentist chair is a little bit of a confessional chair as well. And the patient might be lying there and all of a sudden they come out with some random gibberish about the wife or their partner or whatever. And you've got to have to act as a counselor. sometimes a marriage counsellor, for example. Okay, so you've got to be prepared for every eventuality, and that's why you need to be quite good at talking to people. You've got to, we always go on about showing empathy and sympathy. They're some of the qualities that we look for, okay? Because you can't be dismissive. If someone is stressed or whatever, lying in your dental chair, you can't say, listen, come on, I need to get on with this extraction. I've only got 10 more minutes to get this tooth out. Shut up, let me get on. You've got to sort of incorporate people in some form or other. So, but every day is different. So flexibility, I think.
Great, thank you. Did you want to add anything, Simon?
Not much more to add to it. I think the main thing is work-life balance, which Dr. Barry talks about. But besides that, everyone has their own coping mechanisms. So whatever that is, you'll find that along the way.
Okay.
I think it's very important to have a mentor as well, someone that you can talk to who knows your job, okay, so that you can sort of talk through difficult cases, difficult patients, difficult situations, who's slightly out, possibly not who you work with, but someone who's out of that environment. I think it's very, very important to have a mentor.
Great. Can you all still hear me?
Yep.
Okay, so moving on to our next question. I know, Zaman, you did cover this, but so perhaps it might be interesting to get Dr. Berry's take. What advice would you give to your younger self applying for dentistry?
Make sure you really want to do it. Okay, there's nothing worse than coming in and doing a course and you feel, I'm only doing this course because my mum and dad told me to do, or it seemed like a good idea at the time. You need to do your research to make sure that dentistry is right for you, because it is, we are slightly weird being dentists. Let's face it, we are. Okay, we're putting hands in people's mouths. We're dealing with a bit of spit. We're dealing with a bit of blood. So you've got to make sure that it is right for you. So this is where your work experience comes in. This is where you need to talk to dentists. This is where you need to talk to our student ambassadors as well, and get their take on it as well. As Zamin has said, it is a very difficult and hard and long course. Okay, so you need to have a little bit of resilience as well to get through. Okay, so yeah, they're probably my main sort of take-home points.
Another question that I can see is, how much of dental school would you say is practical work?
To be honest, once you get past first year, second year, you mainly start clinics towards the end, but once you hit third year, it's basically all practical. So this year, fifth year, I was in clinics, 4 or 5 days a week. It's really practical based. You have to develop that skill, and they really help you along the way. There are so many really good tutors at uni, well, regardless of what uni you're at, but they'll help you get there.
That actually brings us to our final question quite nicely. How much practical work do you do in dental school from the beginning, especially?
To be honest, in first year, not much from what my experience was. It's mainly, learning the theory, learning, it's exactly that. It's theory. It's, before you have to apply it to real patients, you're applying it to those PBLs that I mentioned. And then once you've picked up those skills, once you picked up the knowledge, you're learning the practical aspects in labs, and that starts in second year. But you only start seeing patients in third year. So I should have clarified that, earlier. It's labs and clinical skills in second year, and then patients onwards from third year.
Okay.
So within 6 weeks of you landing, at our doorstep in the October, you'll be on the clinics with sort of more experienced students, seeing how they work and everything. But in the second year, we take you into the clinical skills lab where you'll be hacking away at plastic teeth. Do you remember that, Zamin? Yeah, where we sort of give you tasks to do. They're on plastic teeth in sort of false heads. You drill away and you develop your skills, because obviously you've got to learn those skills before we let you loose on the general public. And then on the third year, you then start, simple tasks on patients, and then you develop your skill. And then hopefully by the time fifth year comes, you're a lot more competent and you'll be doing the bigger bits of dentistry, if you like. So it's a gradual build up.
Yeah.
Okay, that brings us to the end of our Q&A. Thank you both so much for all the questions and for the talks. It's been amazing, and I'm sure the students have learned a lot.
Hopefully they have. Thank you very much for asking us again, and hope you enjoy the rest of the evening.
Thanks for having us.
Okay. Yeah, we'll now be moving on to our next speaker, who is Dr. Tafar Hannan. Dr. Tafar is a junior doctor. He's currently working at a hospital in Newcastle. He also is alumni from Barts, and while he was at Barts, he was the co-president of SAMDA. This evening, he'll be talking to us about life as a medical student at Barts.
Hello, hi Abisha. Thanks for such a warm welcome. How are you? Are you okay?
Yeah, I'm good.
Can you hear me loud and clear?
Yep, we can hear you.
Okay, good. And I'm good to get cracking, yeah. So hi everyone, and welcome to my talk on life as a medical student. I understand this is different to previously not being able to do it physically, which kind of removes the intimacy from it, but I've tried to make it as humorous and engaging as possible. So I've added some memes here and there to kind of keep you all awake. So we'll get started. So here's the first meme. This is probably one of the first memes of medical school that I saw. Obviously, you've got some basic life support. Instead of calling an ambulance, you call the ambulance. To continue. So a little bit about who I am and my background growing up. And how it started. This is me in the early days, and then this is me now, graduating as a doctor. So where am I from? So I'm from a town far from the realms of Barts and The London. So if you can see the screen, the Barts and The London is this flag here, and I'm all the way over there, about 300 miles away. And for the Game of Thrones fans out there, I'm from beyond the wall, so the Kingdom of the North, which is quite alien to a lot of the Southerners. And not just Newcastle, I'm from a small town called Whitley Bay, which has beaches, sunsets, and vibes. You name it, Whitley Bay has it all. So a little bit about my education. So as a student coming from a disadvantaged background in which my parents didn't have access to higher education, they migrated from Bangladesh. I was humbled to study at some local state schools. So I wasn't fortunate enough to go to grammar schools, but I was still humbled at the opportunity to study in a state school. And there's a picture of me at my high school with my year 13 A-level results. It's either I'm smiling at the results or I'm probably just stunting for the gram. But just a bit about what I studied in my journey toward medicine. So the GCSE subjects I've studied, I've got them listed here. As you can see, I was a nerd at maths. So maths was a big focus of mine, especially during GCSE time. So my actual maths GCSE, I conducted that when I was in year 10. And the further maths I taught myself when I was in year 11. And to be honest, that was one of the biggest experiences of my life. The first time that I had some form of independence where I controlled my own learning. Because I guess in school, it's more the teachers kind of, to an extent, spoon feed you metaphorically the content. But this was the first time that I kind of got to learn one of the best taglines and mottos of life, which is, where there's a will, there is a way, which I think is probably quoted by Angela Merkel, but we won't talk politics, which essentially means that if you're determined to achieve something, that no matter what happens, you'll always find a way to accomplish it, regardless of whatever obstacles come your way. like myself, teaching myself further maths was a big ask, but it worked out for me in the end. And then for A levels, I studied biology, chemistry, maths, and further maths. My top tip would be life is all about balance, maintaining studying, as well as chilling as well, and relaxing and having some downtime. And the top to do well in A levels is past papers. They're your best friends. Past papers, you should live, breathe, eat past papers, not physically, but obviously metaphorically. So my medical application. So the first thing, one of the biggest hurdles to accessing medicine is the UCAT and the BMAT. For myself, personally, I only sat the UKCAT. At the time, it was UKCAT, not UCAT, but it's the same. And the reason that I only sat the UCAT was that my score was pretty good, and I was quite happy after I received my score. So with the UCAT, once you sit it, you get the results straight afterwards. And with the result, I was quite confident that I would get some university offers. Obviously, looking at previous averages, I was quite above average, so I was glad about that. And to be honest, the main reason why was because I didn't really want to put myself through the headache of stressing for another exam. Like, I'd literally done my mocks in year 12, then I sat the UCAT, and I was not bothered to do the BMAT as well. It's a lot. And I'd rather enjoy the rest of my summer, because at the end of the day, life is about balancing between dedication to studying and lifelong learning, as well as making sure that you enjoy and make the most out of life. So the universities that I applied to were Newcastle, Nottingham, King's College London, and of course the best of the best, Barts and The London. So as you might think, I applied to 4 universities. I did well in my UKCAT. I was quite confident. I did well in my A levels. And you think you might be thinking, oh, I definitely got all 4 offers, or I definitely got all 4 interviews. I'll be honest with you. So Newcastle, I had an interview with. Nottingham rejected me straight off the bat. Didn't even think about me. Didn't even invite me for an interview. They were like, yeah, we don't want you. KCL gave me an interview, and Barts gave me an interview. So after those 3 interviews, Newcastle, King's, and Barts and The London, I did only get the 1 offer from Barts and The London. And at the end of the day, 1 is all you need. You don't need 4 offers. You just need 1. You just need 1 opportunity to get there, study medicine, and become a doctor. And the main advice that I'd give in terms of this is to not be put off by rejection. Because rejection, it's nothing more than a necessary step in the pursuit of success. You will go through rejections. It will be difficult, but ultimately all you need is that 1 opportunity for you to shine, and one day you'll become a doctor. My next meme, I think anyone that's even when I was applying to medicine, pre-med, everybody's asking me, what's this, what's that? And all I know about is photosynthesis in biology. I don't learn about anything else. But yeah, this is a standard, especially as an Asian. So the main thing is, why did I choose medicine? Which is probably the question that you guys are asking yourself whilst you're joining the SAMDA's wonderful event. So initially for myself, my desire was to be an accountant, actually, or to be in the finance industry. And the reason being is one of my aunties, she's an accountant, and she's quite well off. So I was looking at that, and I was like, I want this lifestyle. I want this lavish lifestyle. And then after a while, I started learning about biology, and it's really quite interesting. And I attended something that Newcastle University hold, called the mini medical school. And essentially, what that is a series of lectures. It's what it is on the tin, mini medical school. And I really enjoyed it. Like, I was like, you know what? I've never actually thought about being a doctor, so why don't I consider it? And then a few things happened in life where I was in a position where somebody needed some help medically. And at the time, I felt completely helpless. Ultimately, I could do nothing. And that feeling of not being able to do anything just really got to me. And I realized that, what if I do something and put myself in a position where whenever anyone's going through a difficulty, especially medically, specifically medically, that I'll be able to do something and give back. Because at the end of the day, gratification and, enjoying what you do is everything, and everything else that isn't gratification is secondary. Money comes and goes, fame comes and goes, social, financial freedom comes and goes, but ultimately the legacy that you leave behind is forever. And that's kind of what I went by, and that's why I wanted to do medicine, because I'm a huge advocate of giving back and helping others, and medicine will allow me to do that. So I hope that answers that question, if anyone had that on mind. So speaking about my why medicine, we'll talk a bit about my medical school journey. Just another meme. This is so sad but true. It's not really true. So preclinical years. So preclinical years. So primarily they are theory based, because at the end of the day, if you're going to be jumping onto the wards, you need to have all of the knowledge. So the preclinical years provide you that ammunition to then deliver that quality of care when you're on placement. So at Barts and The London, we are a PBL university, but it's also slightly integrated. So we have lectures as well as PBLs, and the lectures kind of couple or are in addition to the PBLs. For example, you might have a PBL based on, let's keep it simple, a stroke. And all of the lectures that week of the PBL will also be based on stroke. So they kind of benefit each other. So it solidifies and cements your knowledge further. And the main thing that you learn in preclinical years is your revision technique. And honestly, I wouldn't be put down if you're not sure of your revision technique even now, because even I, myself, after 5 years of medical school, still have no idea of what my revision technique is. So for example, some people used Anki flashcards. I sometimes use flashcards depending on which content to use. Another style of revision technique is this, which you'll find really interesting. So this is something that I used. It's a cartoon, and it builds a story to help you remember things. So this is a cartoon. I'll just go through it briefly on SSRIs, which are selective serotonin reuptake inhibitors, which is a form of medication. And then all of these, every single thing in the picture is to do with the drugs. For example, out with the flu. If you stop taking the medication, you get flu symptoms. That's just an example. So that's what I use for that. But then overall, I'm quite old-fashioned. I love hand paper notes. Blue light filter, I don't like that. Everything is handwritten. So here's just a picture of some of my notes. And the last thing about preclinical years is exams. So exams in medical school, particularly at Barts, but I think around about across most medical schools, is you have multiple choice questions, which is good because the answer's there on paper, so you don't really have to think that much. But we also have in Barts, especially in the first 2 years, short answer questions. So I'll give you an example of a multiple choice question, which was from my year 4 examinations, one of the papers that the university provided. So again, it just gives you a brief vignette, and then there's a few options as well. And then we also have a visual examination. So it's called a spotter, which is a series of pictures, graphs, etc. Anything that you can put a picture in, essentially. And say, for example, this was the picture. It would be like, what is A? Or it'll point somewhere else. What is this? Which then helps solidify and cement your anatomical knowledge. So although this is a meme, it's something that I kind of wanted to highlight, and something that I recognized myself when I joined university, is that while you're in your state school, whilst you're in high school, sixth form, college, you're probably, one of the smartest people in the school. And I'm not saying that in a boastful way, but it's probably true. If you're applying for medicine, highly admired and honorable degree, then surely you're going to be one of the most smartest people in your sixth form in college. And because of that, you score very highly in exams. But once you enter medical school, everyone is on the same level. You're all very, very highly intellectuals. And you're in a room full of like-minded people with similar academic potentials. So if you get 78% on a medical school examination, you'll be over the moon. So that's just something that I noticed. So clinical years. So clinical years, how do they work? So at Barts and The London, clinical years work on a speciality-based rotations. So in year 3, you have cardio and respiratory. So placements to do with the heart, as well as placements to do with the lungs, essentially. And then you'll rotate to different departments. So throughout medical school, you'll cover every single department there is, bar the minor few which are very, very niche, like plastics. Neurosurgery, you might get the opportunity, but yeah, generally, yeah, it covers every single department. And at Barts, we have a wonderful thing, which is the spiral curriculum, which honestly is the best thing that Barts provides, because whatever you learn in your first 2 years get coupled with whatever you learn on placement. So for example, in years 1, you'll cover the hard stuff. In years 2, you'll do the same. In years 3, you'll do it again. And then by the time year 3 comes, you'll be a genius and you'll know everything. Hopefully, that's what they aim for. So what do you actually do? What do I do as a medical student? So it varies. In your first few years, it'll be mainly communication based, because you're new to the wards. People won't expect you to take bloods from the patients. From all the patients wouldn't expect you to do discharge summaries. You're still new, so you need to kind of find your feet. So the first things that you'll do is speaking to patients and developing those perfect communication skills. So you'll take history from the patients. You'll document in the notes what your findings. You'll do examinations on patients. Especially throughout medical school, you might not have seen any signs, clinical signs. So you'll learn some signs in that time. And then as you progress through medical school, years 4 and years 5, you're getting closer and closer to the position of a doctor. So once you're on the wards, that you'll be expected to do things that a doctor would do, particularly in year 5. So it varies as you progress through medical school. So what's my worst moment of medical school? I wouldn't really say there's particularly any worst moments, because I thoroughly enjoyed it all and I'm going to miss it. And I do miss it already. I'd say the worst ones are the difficult ones, where things don't really go to plan. I remember there was one occasion where I was on the intensive care unit, and there was one patient who I literally saw in the morning, came back from lunch, and all of the doctors were rushed into that room, and I was like, what's going on? One of the junior doctors was like, jump in, like, come quickly, see what's going on. So I quickly rushed there, and the patient had a clot in their windpipe, which was blocking it and making it difficult for them to breathe. And there was the anesthetic, there was the anaesthetist, there was the registrar, there was the consultant. Everyone was working to try and get this out. Unfortunately, things didn't go to plan. Unfortunately, the patient did pass away, and those are the most difficult ones, when things don't go well. And to lighten the mood, my favorite moment was my final placement in final year, which was, I think, all of them in final year, but I really, really enjoyed general practice, because the rotation that you have in final year is as if you are a GP. So I had my own room, my own desk, my own nice chair, could get tea and coffee when I want. But because it was COVID at the time, everything was telephone triage, and if necessary, to bring patients in. So I felt like I had a lot of control. So I'd call patients, find out what's going on, take a history, give the patient advice, think about what could be going on, go to the GP and explain and tell them my findings. And if they agreed with the diagnosis, then they would ask me, what's the management plan? Go and tell the patient that this is going to be your management plan. So I literally felt like, I was a GP at the time, although I'm very quite, 5 years away from that. But honestly, it was a moment I really, really enjoyed. So my clinical years in COVID edition was, working in the GP practice whilst helping out with the vaccine, and studying for medical school exams. So that's kind of how COVID affected my medical school progression. But yeah, I was really, really honored to help with the vaccine. One of the best opportunities of my life. So I hope everyone is still awake, and we'll just go through a few quick common misconceptions. So one common misconception that I have heard of is that if I study medicine, I'll have no social life. So here's a meme that kind of goes with it. There she's dressed for her wedding. I'm guessing it's probably a catwalk, but Asian attire, and she's reading her books. I mean, I'm not going to say I haven't done that before or something similar. But again, one thing I learned, it's all about balance. Revise when you should revise, and you have to enjoy life. Life isn't all about studying. So, like I said, when it's time to revise and put your phone away, this is one of my friends, it's revision time, and he had enough of his phone as a distraction, and there you go, he threw it straight in the bin. And when it's time to revise, you revise, and when it's time to study, you put in the work and you study. And when it's time to relax, and when it's time to climb mountains and, go on a holiday and have some time and rest on the beach, then you do that. Again, it's knowing about when it's time to study. When exams are coming up, you study. When you have free time, make sure you have some downtime, enjoy yourself, because ultimately you'll come to a point where you'll need to study for exams. If you've had that time to relax, you'll have a clear mind to do so. A few more misconceptions, and I'll try and quickly wrap up. I'm not sure if I'm going over time, perhaps. So night owling is the new normal. So a lot of people think that medicine is full of sleepless nights. This is me sleeping in university, and this is me, late nights. It's not. I'd like to say I've never done an all-nighter in my entire life. Apart from obviously if I'm working a night shift on placement, but I've never stayed up all night to revise. Again, life is all about balance. Sleeping early is one of the most important things. If anyone asks me, the most important things are sleep and breakfast. Breakfast is the most important meal of the day, and sleep is the most important thing. This was one exception of me sleeping in university. At the time, it was Ramadan, which is fasting time. So I was awake at 3 a.m. to eat something before the day of fasting. So I was tired in revision time, so I had to take a quick nap. Everyone is smarter than you. So like I said, everyone has come from a position of being the smartest in their school, college, in their year. So a lot of people go in there thinking, everyone else is going to be smarter than me, but you're all very, very highly intellectual. And at the end of the day, it's all about helping each other. And if you put in the work, then you'll see results. And here's just some memes just for you to enjoy. So my finishing anecdote, just to end, is that it honestly was probably, I'll remember it for the rest of my life. At the time, I was a third-year medical student, and it was Eid Day, which is essentially, if you're not sure what that is, it's the Christmas equivalent, not really equivalent, but just for you to understand, for Muslims. And I was out with my friends having dessert. And we were just sitting there enjoying dessert. My waffle just came. I was, so excited to devour it. And one of the waiters walked in from outside, carrying another one of the waiters in his arms. I looked down at my waffle, as appetizing as it was, and then I looked back up at the situation. My heart was racing and it was pounding, and I jumped up because nobody else was there. I jumped up assessed the situation, did a quick assessment of the lady that was unconscious. She was breathing. I did my quick ABCDE assessment, and she was fine. I called the ambulance, and now she's very well, and I see her regularly when I go to the dessert shop. But honestly, the profession that we're going into, we can do so much to help others, and that's honestly truly humbling, and I'm very, very grateful for the opportunities that I've been given. And then I came back, and my waffle melted, and the ice cream had melted, and I was on too much of an adrenaline high to ask for another one, but they did offer. And the last thing is a quote you might have seen on Instagram, and it's something that I kind of adapted from something that someone else told me. If you want to finish medical school with merely your MBBS degree, then you have failed medical school. Do more, be better, and benefit others. And this motto isn't just for medical school. If you are to achieve something in life, or if you are to get far in life or accomplish something that you've been striving to achieve, if you just achieve that one thing in your whole journey, then you failed, because more people should benefit from something that you do. You should try to strive to help others and not just yourself. We should all shine together, as they say. So that's one of my biggest mottos in life, is to do things that benefit others. That being selfless is the way forward. And thank you very much for your time, guys. If you do have any questions about myself, my university life, or medical school, or anything about me additional that you'd like to know, then just do submit them via the SAMDA form, and I'll answer them in the Q&A. Thank you very much. I hope you enjoyed that, guys.
Thank you so much for that.
Didn't go over time.
No, you're all right. We still have a bit of time. And yeah, guys, if any of you guys have any questions that you want to ask Dr. Tafal, please do comment on our Instagram post. Yeah, and we'll catch up with you in a little bit for the medic Q&A.
No problem. Thank you very much.
Thank you. Okay, so next speaker is Dr. Leslie Robson, who, alongside being SAMDA staff president, has also been the head of Year 1 and Year 2 of the MBBS programme at Barts and The London since 2013. Today, she'll just be giving us a short introduction to medicine as a career.
Hello, everybody, and thank you for inviting me to this evening to hopefully give you a bit more of an introduction to what you might expect at medical school. So again, you've heard from an excellent talk from a medical student. So this is our first opening slide, which is: a good physician treats the disease. A great physician treats the patient who has the disease. It is not all about the science, it's also about communication, about being able to put a patient at ease and to treat the person holistically, to think about their social situation, their family situation, not just what is wrong with them, how that disease might impact on their family. And that's what a great physician does. Hopefully, if you get into medical school, you'll end up working for the NHS, now got a George Cross, been going for over 70 years, and is a world-leading institution in delivering healthcare to a nation. And I think you've seen in the last sort of 18 months what the NHS does. And actually, I think it's made people appreciate the NHS and that it's there for all of us, and also appreciated the work of doctors and other healthcare professionals. So, doctors should reflect the population they serve. And this means that even if you don't think that your doctor represents you, your community, that shouldn't stop you from going into medicine and changing the face of medicine. Everybody has or should have that opportunity to contribute to that profession. Barts and The London is very lucky. We have a very diverse student body, and we have a very diverse patient body as well. And we cover both rich and poor areas. So where St Bartholomew's Hospital is, it's a very affluential area. The Barbican which is expensive flats, is just around the corner. But we go all the way to Tower Hamlets, out into one of the poorest boroughs in the country, certainly in London. And that means that we see a very diverse range of patients with a very diverse range of conditions that they present with, but also our students represent that student body. We've got quite a lot of locals that join the medical school. But you are also part of a team. And in this part of the slide here, we've got an orthopedic patient, but it's not just your orthopedic surgeon that is dealing with that patient to deliver their health care. You've got an anaesthetist, you've got the laboratories, the pathology, the histopathology departments, which have histopathologists, which are doctors that are looking at biopsies, checking that there's nothing untoward. You've got, of course, got the nurses. We've got the physiotherapy and the peri-operative services. We've got the pharmacy and the administering of drugs and making certain that the right drugs are administered and prescribed for that patient. Again, physiotherapy for rehabilitation. All these individuals, and I'll show another slide later, contribute to the care of the patient, but the patient should be at the centre, and it's all about patient-centred care. But medicine is not something that is quick. For most undergraduate A100 courses, they are 5 to 6 years, and it depends whether they got an integrated extra year for what they call an intercalated, which gives you an extra degree, a BSc. If you've already got a degree, then you can potentially apply for a accelerated program, the graduate entry programs, which are offered by a few medical schools, including us, which is 4 years in total. So if you come into medicine with a degree, minimum is 4 years at medical school. The majority of medical schools, and there's somewhere, well, there was 32, it's now increasing, there's a few extra new medical schools that are starting around the country. Most of those will offer undergraduate, and some are 6, like Imperial, which have a kind of already integrated extra year. If you come to Barts and London, that intercalated is optional, so 5 years. But even then, when you graduate, you go into the foundation schools, and that's another 2 years minimum, F1, F2. It can take longer because you can do it part-time, or you might need to repeat a year. And then you go into your speciality training. So if you're going ST1, which is usually sort of surgical, you can go into GP, which is a little bit quicker. Core training, mainly sort of non-surgical careers, but you can switch. So you can go from core training into surgical if you fancy doing a bit of surgery as well. And it's only then that you are at the level of a consultant. So all of these are junior doctors that are making up the vast majority of the workforce, and the doctors that you will see are mainly junior doctors. So the start of your journey is getting into medical school. Now, it doesn't matter which medical school you apply to or which medical school you eventually go to. All of those medical schools, 35 I think we've got at the moment across the country, Aberdeen in Scotland, all the way down to Plymouth, several in London, East Anglia, University of East Anglia, Wales, Swansea, Cardiff, all of these medical schools, all of them doesn't matter which one you go to, all of them, their course is regulated by the General Medical Council. And the General Medical Council has come, inspected, and made certain that the course is fit for purpose and meets these outcomes, that the curriculum meets what they have published. And you can go onto the GMC website and read it, which they call Outcomes for Graduates. And I think the latest was in 2018, although they've made minor amendments sort of last year because of the pandemic. So the GMC regulate doctors, but they also regulate the medical schools to make certain that the medical school that you go to is fit for purpose and the course is fit, so that when you graduate, you are able to go and do the job. Most medical schools will follow this progression. Year 1, Year 2 are your kind of more sciencey based years. Some medical schools, more traditional ones, will call it pre-clinical. We're going to call it here at Barts early years, because we give you early patient contact. So we do have this early patient experience. We give you hands-on practicals, we teach you clinical skills, and we teach you team working. So that's your Year 1, Year 2. That's where all the hard science is. Then, as you've heard, the more clinical years, you're out on the wards on a more regular basis. And Year 3 is, here at Barts, is mainly cardiorespiratory, metabolism, so gastrosurgery, endocrinology, and those specialities. Whereas Year 4 is all the other specialities, so obs and gynae, so delivering babies, pediatrics, looking after babies, neurology, looking after people with nervous diseases, psychiatry, mental health, rheumatology, and sort of healthcare of the elderly are all sort of lumped into Year 4. And then Year 5 is preparation for practice. This is when you are really preparing for your finals, you're getting ready to go out and become a doctor. But all the way through, you're learning the scientific basis, and it continues. You're still learning how to use the knowledge that you got in Year 1 and Year 2 and apply it to your patients. There is a little bit of clinical management in the early years, but it becomes much more common and more predominant in the later years. And all the way through, you're learning about professional standards, what it is to be a doctor. Medicine is not like any other course. You are a junior member of the profession from day one. So when you go into medical school, you are still bound by the GMC professional standards and code of conduct. So it is about maintaining patient confidentiality, even in Year 1. If you meet a patient, you have to maintain that patient's confidentiality. It's about maintaining your professional standards. So you've heard about how you need to have a social life, but it's being professional that that social life doesn't impinge on your ability to be a medical student as well. It is about lifelong learning. So as you've seen, it's not a quick career. It's not a quick course that you're going into or potentially thinking of. And it is about lifelong learning. So the life so short, the craft so long to learn, by Hippocrates, who was the or is seen as the father of medicine. So even back in ancient Greece, he recognized that actually you continue to learn. You are continually learning something new every day. And it's about learning how to learn. We're often asked, what's the difference between school and university? And especially for medicine, it's about learning how to become independent learners, how to manage your own time, how to go away and research things and to bring it back and work as part of a team. So it's about lifelong learning to be able to cope with your career in the future. But medicine is changing, and certainly in the last 18 months, some of the changes that were slowly coming in have been accelerated. So certainly this personalized and genomic medicine is becoming much more trendy, because we even know that the COVID-19 virus, which you've got here in the middle, affects different people in different ways. And why is that? And that's because an individual is an individual. Their unique set of genes, environmental factors, influences how this virus impacts on their body systems. We're moving away from this. This is the Perrin Lecture Theatre on the Whitechapel campus. This is the big lecture theatre, seats 409. For 18 months, we haven't been able to use it. All the lectures and a lot of the teaching has gone online, like tonight. And this gives us a way of pre-recording lectures, doing some of them live, but doesn't mean or means that you can access those lectures in your own time. So we're moving away from this. But even patient-doctor consultations are moving away from a lot of this face-to-face communication is moving to online. So doctors don't need to be in the same room as the patient. They can have colleagues in the next room, or actually in another hospital, or actually in a different country. And the internet and Zoom, Microsoft Teams, YouTube, all of these have been able to connect us worldwide and allow us to continue to do our job throughout the pandemic by being able to communicate and share information. So we're doing both of this. And it's not going to go back 100% to how it was before. A lot of GPs, my own GP, has put in a new phone system, put in new televisual communication systems, because they realise that actually some patients find it more convenient to communicate with their doctors when and how it suits them staying at home, and only having to go in when it's essential for a physical examination. And that still exists. There is still this need for hands-on contact. There is still this need for hospitals to exist and for GPs to exist and for you to be able to interact with people and your patient. This is a simulation using a sim model to train up, and you can see that there's a lot of equipment and the trainer is standing by the side. You've got the X-ray showing the procedure as it's being done. Now, I hope you've all got a bit of a strong stomach, because the next set of slides, and I'm just going to come out of here now so I can see what's going on, was that the girls asked me to produce some pictures and some questions. So we're going to have a go at these questions now. So if we go to the first one, hopefully. Okay, so what we've got here, which of the following would you want to check first? And you've got a choice of checking the blood supply to this individual's toes, feeling in the toes, so can they, if you touch the toes, can they feel it? Or movement in the toes, can you ask them to wiggle their toes? This is an open or compound fracture of the tibia. The tibia is the big bone below your knee, and this is the ankle joint that you've seen. They often turn up in A&E departments that people have fallen, tripped over the curb, been involved in a road traffic accident, and they turn up with a bit of old towel wrapped around the leg and a cardboard box. Cardboard boxes are very useful. They are relatively clean, they're relatively sturdy, So they can be used as a splint to prevent too much movement of the bones and the leg. And so often they turn up in A&E wrapped in a cardboard box. So don't forget, if you're out on the street and see a bit of trauma, cardboard box, look for it. Okay, so I've talked you through it. So whenever you're thinking of trauma, you've heard it from our medical student previously, which is your A, B, C, D. So A is airway. Well, this is the leg, so we'll assume that his airways are okay, so he's breathing okay. B is breathing, so are they breathing? Yep. See, C is the important one in this case, and that's circulation. So this is about circulation. We need blood. Blood is delivering oxygen to the peripheral tissues, and it keeps those tissues alive. And if the blood supply to the toes has been damaged in any way, then that is going to compromise the foot in its entirety. As a clinician, I'm not bothered about the feeling or the movement, because peripheral nerves are able to regenerate. They are able to regrow at about 3 millimeters a day. So if the nerve is injured, and it might well be injured, then yes, for maybe 3-4 months, this individual might have reduced sensation or reduced movement, but that should come back, maybe not 100%. But if the blood supply is compromised to the toes for more than, say, 2 hours, that potentially is going to cause lasting damage. So I would check the blood supply to the toes, see if he's got a blood supply, see if he's got a pulse, peripheral pulse on the top of the foot. You can do pulse oximetry, so stick a little meter on that will just measure the oxygen saturation in the periphery. Okay, so we have the next one. Okay, we've moved up to the upper limb. This is a 29-year-old man. This is a real case. He's from Bristol. And he was doing some DIY and managed to saw through a piece of wood, and the surgeons attempted to reattach the thumb, but it was too damaged. You can see that it's very mangled. It's not very good looking. And instead, they were deciding what to use, and they actually grafted one of those options. So you've got the left thumb from his brother, who is right-handed, the man's second toe or big toe, and the thumb from the right hand, because this guy is left-handed. So actually what they did was they did actually take his big toe and took that off, amputated it, grafted it on in place of his thumb, and it worked beautifully. So perfect, you all got that one. The man's second toe, it kind of depends. It depends on how big your big toe is, really. So your big toe, if you look at it, is a lot fatter and more chubby than your thumb. And so if you take the thumb, you often have to kind of what they call depulp it, which is kind of narrow it. The second toe might not be as big, but it's more of a similar size to your thumb. So they often take the second toe instead. And the last one is an CT scan, so a computerized tomography. Here we go. So what we have here is a CT scan. It's a modification of an X-ray. And you've got a 25-year-old woman arrives in the emergency department with a stab wound to her chest. There's only a small amount of blood on her clothing, and her blood pressure is 110/80. Your normal blood pressure is about 120/80 if you're fit and healthy and young. but you note a transient drop to 85/70. The CT scan is shown. So what are you going to do? Are you going to pull the knife out because there's not much blood? And as you can see from the CT scan, that's the heart there. This structure is the aorta above it, and the knife is sort of angling down and sort of pressing onto the diaphragm. And I'm grateful to hear that all of you who have answered this think to leave it in. There was an anaesthetist who thought, come on, let's pull it out. It's not hitting the heart. It's not, doesn't seem to be doing anything. Often what you have in this sort of situation is that the knife is actually forming a plug and is stopping the blood from leaking. And you can actually do more damage by taking the knife out without sort of surgical supervision. So which of the following are you going to do first? You're going to leave it in and send her up to the theatre, and then it can be removed. And in this case it was, and she made a relatively uneventful recovery. Okay, that's all I have to say for the moment. If you have questions, please feel free to put them into the chat or into the question and answer session later.
Thank you so much for that talk, Dr. Robson. We're actually going to have the medicine Q&A right now.
Okay, go for it.
Okay, so the first question that we have is, would you recommend doing medicine as an undergraduate degree or as a postgraduate?
It doesn't really matter. There is a cost implication because if you do a degree before you go into medicine, you've got 3 years extra to pay for, and then 5 years or 4 years. So you've got 4, 5, 6, 7, whereas it's slightly cheaper, I suppose, to do it as 5 years. It makes no difference. By the end of the 5 years of the undergraduate, you're kind of at the level that you need to be. That's what the GMC is there for, to make certain that either way you get to the level that you need to be. But if you don't make it into medicine the first time and you still are really passionate about doing medicine, then maybe go and do a degree, and still there is still a path into medicine later. I would say that.
Yeah, I definitely agree with what you said just then, because that's what I did. A degree and then did medicine afterwards. So yeah, I think it's an option.
Mm-hmm. Brilliant. Moving on to our second question. Have you ever experienced imposter syndrome, and how do you deal with it?
Yes. It's a very topical question. And yes, yeah, you do. You always question whether you're good enough, whether you're there because you're making up a quota, whether you're actually as good as you think you are, because you do question yourself. So how do you deal with it? That is a good question, and I don't really have a good answer for that, except you've got to try and believe in yourself. You've got to try and say, look, I've worked hard to get here. I'm as good as everyone else. In fact, I might be better than everyone else. It might be them that think they're just better. And I think so our medical school, we do put into place regular sort of testing. It's not to catch you out. It is to kind of say, okay, have you reached the next level? If you have, perfect. If you haven't, we'll support you to make certain that you get to that level. And the end of year exams are all about reaching the competency. So are you competent to move to the next level? And so I would say that's how you deal with it. You take the feedback, you use it, and if you pass, you say, okay, I've reached the level that this university has set, and they say I'm ready for the next stage. Therefore, I must be ready to move on to the next stage. And I think that's one way. It's not the perfect way. And we're looking at ways of supporting medical students from male, female, from different backgrounds to see if we can support them in that.
Just got something to add. Yeah, completely agree with Dr. Robson. I think you'll always be in a position where you'll feel like, oh, you know, I could have done better, or I should know this, or that you're not good enough in a sense. For example, the easiest way to think about in medical school is exams. You'll walk out of an exam and you'll be like, you know, I should have worked harder. You know, I should have known this question. I should have known this. You literally walk out the exam and all the answers will come to mind. But the main thing to remember is that you put the effort in, you put the work in, and just be confident in what you do know. You'll always be in a position where there'll always be someone better than you. There'll always be someone smarter than you. And there'll always be things that you don't know. And that's just how life is. And that's just how even your brain works. You know, you forget things, and it's just kind of accepting that is the main thing. But also doing and striving things to kind of ground yourself better as well.
Okay. And the next question is, how do you handle or cope with difficult / sensitive situations, kind of like the thing that you mentioned in your talk, Dr. Safar, with the patient passing? How do you deal with these situations?
So I'll give my perspective. Obviously, Dr. Robson will probably have a lot more experience in that. I think with that, it kind of links to kind of what I said previously. Ultimately, there's only so much that you can do. It is difficult. It's definitely not easy. And it's so easy to feel guilty that, you know, I could have done more. I should have done more. But ultimately, should have, could have, whatever's done has happened. And ultimately, there's no such thing as coincidences, and everything does happen for a reason. And you've done as much as you can, and that's the main thing. Most of the time, most doctors go above and beyond. And even if you don't go above and beyond, even doing, you know, your utmost best is the best that you can do. And if things don't go your way, then that's just how it is. And you kind of just have to process it and to accept that you tried your best, but you didn't get the desired outcome that you'd hoped for.
I completely agree. I mean, that, as much as we can, we offer the medical students some training in how to manage those situations. So we do sessions on breaking bad news so that you're not kind of thrown into it. And that's more than some medical schools. I've had some of our graduates come back and say, I've had to run breaking bad news sessions for my other F1 doctors because their medical school doesn't deal with this. And I was the one that they all went to and said, can you come and help us talk to this family, talk to this patient? So as much as we can, we give you that training so that you have the tools. And it is about, and you've heard about the social life. It's not just that the social life is there to have friends and everything. It's also as a way, as an outlet, because medicine is stressful. Dealing with patients is stressful. Dealing with their families is stressful when there is a difficult or sensitive situation, and you need to have some kind of outlet, family, friends, some kind of sport, or some kind of outside interest to be able to manage that stress, and also to ask for help when you need it. That there are always people around. As I mentioned, you're part of a team, so use that team, use that senior consultant, use the nursing staff, use the others to help you. That's what they're there for. You're not alone. You're part of a bigger entity, which is a team.
Okay, thank you. Our next question is a bit of a change. We're moving on to more application side of things. Someone asked, how did you decide which university to apply for? I think Topaz, perhaps, it's more recent for you.
Bit more recent, yes.
So I think the main thing is to first rule out and kind of group the universities based on UCAS and BMAT, because that's ultimately one huge thing that will influence your interview and your application. So once you've done that, easiest thing to do is to look at the university league tables, and which kind of has all of the universities. And the best thing to do is just to read into the university, look at their course structure, their teaching style, and see what kind of teaching style suits the way that you learn. For me, PBL was good because when things get put into context for me, it helps me kind of remember it better, as opposed to just learning just content on its own. Those are the main things I'd say, is just look into the university and what the university provide. Look at the societies, the student body, because obviously university isn't just about the university course. It's also about the place that you're going to be living. For me, it was a huge change coming to London, but it was a decision that I thoroughly enjoyed. There's so much to do in London. London's a beautiful city. So again, think about the student life that you're living. It's not just going to be about studying. It's about social aspects. It's got the living aspect, the cost, etc., and balance all of those things together to come up with an idea of what's best for you.
Yeah, I completely agree. I mean, if you're going to spend 5 years or 6 years in one university, you want to make certain that you're going to be happy there. And I think that's the most important thing. So go and visit it. For me, when there wasn't UCAS or BMAT or GMAT or any of those. You basically just applied for medicine wherever you wanted. And I put down Edinburgh, Manchester, Leeds, and Glasgow. So I was staying fairly in the north because I was from York. And I really wanted to go to Edinburgh, didn't get into Edinburgh, and went to Manchester and loved it. I love Manchester. It's a bit like London of the North, and it was brilliant. It was close to home. I could get home easily. I didn't have that far to travel, and it was a great university and a great medical school.
Okay, and I'm going to be asking our last question for today, which will be, what are some other career alternatives to medicine and dentistry?
So is this somebody who's done done an MBBS and then wanting to go on and do something not medicine? Because we have that. So people have done MBBS. And it doesn't mean to say I would recommend you did the foundation. You don't have to, because once you've done the foundation, you're fully registered with the GMC and it's easier to get back into medicine should you want to. But your MBBS degree, we've had people who have gone into IT and worked in IT in the NHS, but also IT in other areas. We've had people who have gone on to do medical legal, so they've done a law conversion course at the end of their MBBS, and they've gone into that. So their expertise of medical negligence they're using in the medical profession, they're using for legal reasons. We've had people go into teaching. We've had people go into teaching medical students. We've had people go into all sorts of different professions. If you're looking for an alternative to actually applying for medicine, but you still want to stay in healthcare, then I would say, and you want really people interaction, then physiotherapy, occupational therapy, those sort of areas. We had a student a couple of years ago who actually did medicine for the first 2 years, decided actually there wasn't enough patient contact and they were unlikely to have that patient contact, and they really liked eyes, so went in and became an optometrist, which is kind of like the fancy bit of the optician, not just checking your eyes but dealing with sort of eye conditions, glaucoma, and now works at Moorfields alongside the clinicians, but has much more patient contact, dealing with patients on a day-to-day basis. So there's all sorts of alternatives to get into healthcare should you want to.
I think I'll just add one more thing if you guys don't mind. So just literally just to add on to what Dr. Robson said, even one of my friends, he's finished medicine, and as far as I'm aware, I think maybe he wants to become a politician. I've convinced him otherwise, but like, I think in the application prior to medicine, you know, you've studied science subjects, you've studied maths, you've studied really, really strong subjects, and you've got good grades in it. And those subjects don't just take you towards the scientific world, they open up a lot of doors. So my brother works in the corporate world, and he used to work in Goldman Sachs, an investment bank, and he knows multiple doctors that are investment bankers. And he asked them, you know, how did you get here? You know, I've done a degree in computer science. I know how to code. You don't know how to code. How did you get a job in an investment bank? And I think because medically is such an intellectually challenging degree, and it shows that you're bright, you're smart, you're dedicated, that those are the characteristics that every single employer looks for. So medicine will open a lot of doors to many things. But for me, being a doctor is the only door that I want to open.
Yeah, I know one of our ex-students who I think will probably go into politics. Might be the same one, but
I think it is the same one. Yeah,
probably the same one. Yeah, but we've had others that are still in medicine but have got involved with the politics in medicine. So involved with the BMA and involved with that side, and representing other medical students and medical doctors as well. So there's all sorts of different careers. One of the slides I didn't show was all the different career paths. MBBS is a starting point. You can go in all sorts of directions within medicine or outside of medicine.
Yeah. We won't have time to answer the rest of the questions, and I can see that there are a few more that people have sent through, but I'm sure that Dr. Tafar will be willing to answer them if you email him directly. And for the UCAT thing, SAMDA has done a UCAT course literally just a week ago. It's on the YouTube channel. You can check it out. I'm sure there'll be lots more tips for UCAT on that video. And similarly, there was a work experience thing as well. So if you've got questions about that, you can check that out and email us directly. We can answer some more questions. But for today, we're going to have to move on. Thank you so much, Dr. Robertson and Dr. Tafar.
Thank you, everyone. I'll maybe see you later at the closing.
Thanks for your time, guys. Thank you.
Thank you. Okay, and for last speaker this evening, last but not least, it's Alistair Robertson. He is the Widening Participation Manager for the School of Medicine and Dentistry, and this evening he's going to be giving us a bit of insight into the UCAS application process itself.
Okay, hi everyone. Can you hear me?
Yeah, we can hear and see you.
Excellent. Can you see the screen?
Yeah, we can see everything. Thank you.
Excellent. So I was just checking my camera. I wasn't like looking at the sky or something like that. Okay. Okay. Hi everyone. Thanks to SAMDA for inviting me along this evening. So I am just going to give you a sort of 20-minute overview of all the things that you need to consider when you're applying for medicine or dentistry. I think some of the topics you've probably covered already this evening. There's probably some information on here that you perhaps are unaware of. So hopefully there's something in there for all of you. So my name's Alistair, and I will take questions at the end. Okay, so first thing to think about, again, this is something that you've probably already covered today. You've probably heard from different speakers about what their reasons were for pursuing a career in medicine or in dentistry. It's a really important question. You're going to have to answer this throughout the application process. So whether it's in your personal statement or at the interview stage, and try and think of more than I want to help people and I like science. There's lots of different careers that you can pursue your passion for science and kind of wanting to help people. So what is it about medicine or dentistry as opposed to being a science teacher or a nurse or dental hygienist? So what is it about these careers that you're kind of not so sure of, but actually want to go and pursue medicine or dentistry? So I think you've touched upon this, one of the previous speakers just a couple of minutes ago. But certainly if you're thinking about universities, there's lots of different medical and dental schools all over the country. There are lots and lots of medical and dental schools in London, and there are lots, like I say, all over the country in all sorts of settings. So whether you're from London, whether you are in would like to go to a big city or perhaps a more sort of rural type location, there are pretty much, I would say there's probably a medical and dental schools that are in all sorts of locations around the country. They also differ in size. Some can be quite small, other courses can be larger, other universities can be larger. Some might be based on one campus, others might be spread throughout a city or town. So have a little think about what works best for you. And that's certainly something that you should consider. And also, I think this is something as well that was touched upon a moment ago. So have a think about how the course is taught. Do some research. So whether that is using kind of subject league tables, there's all sorts of different league tables, taking into account all sorts of different criteria. There's lots of, obviously every university will have their own dedicated web pages. There's the Medical Schools Council, Dental Schools Council's website as well. So there's lots of resources to draw upon when thinking about this. So have a little look at the types of teaching, the types of learning. You have already heard how we teach medicine and dentistry at Barts. So have a little look and see, is this something that actually works for you? Are you someone that does like a lot of group work? So a course that has a lot of PBL content is a course that is suited to you? Or do you prefer a bit more kind of lecture learning, independent learning? You'll find all about the clinical contact, the online provision, all these sorts of things. So have a little think about that, do some research and think about what works best for you. Okay, so talking of entry requirements now, as I'm sure you are aware, these will differ between universities. So I'm just going to talk about the academic ones to start off with. So for example, for us, for the GCSEs, we ask that you get a minimum of 3 7s and 3 6s. That's to include English language, maths and science. And at A level, we're looking for you to get A star and AA. And that's to include 2 sciences. So you must have done biology or chemistry. And then the second science could be biology, chemistry, physics, or maths. We count maths as a science as well. And then the third subject could be something completely different, although we do not count general studies as an A level. So match the grades to your universities. So the predicted grades that you're likely to get with the universities and the courses that you're interested in. If you don't quite meet the entry requirements, you're highly unlikely to be invited for an interview or an MMI or a group interview, whichever the university you're applying for uses. Because as I'm sure you're aware, medicine and dentistry are extremely competitive degrees, and universities are looking for ways to cut down applicants. So one of these is the academic entry requirement. So you would need to match the grades to the universities. However, there's lots of different universities that take different grades. So it's worth having a look to see which ones there are. And again, this is information on universities' websites. Also, the Medical School Council and Dental School Council will have this information as well in a really useful and easy to read way. Again, this was touched upon a moment ago. So UCAT, BMAT, these are aptitude tests, admissions tests that you would have to take. So again, check the universities that you're applying for. You might only have to take the UCAT, or you might have to take the BMAT, or you might even have to take both. So check. So for us, we ask that you sit the UCAT and that you get a minimum of the 3rd decile or above. And we use a 50-50 weighting for the UCAT and A-level grades. So match your score to the universities that you are applying for. Again, remember, we're all very, very competitive. Lots of applications we get. So make sure you do match those. Universities, like I say, do use them in slightly different ways. So perhaps you don't score quite so highly on the UCAT, but you do really well in your A-level predicted grades or your A-levels, then you could perhaps still apply to. You could focus on universities that weight A-levels more than perhaps the UCAT, if that makes sense. But also have a look at, like I said, how universities use these. Some will ask for like a minimum of 3rd decile. Some might say you have to get an average of X points in each section. It will just depend. And again, if you don't quite get the grades, the score that you need, perhaps for the UCAT, you might have to consider taking the BMAT, because you can only take the UCAT and the BMAT once per year. But the good thing about the UCAT is you get your scores immediately, so you know what you've got. Also, in terms of the UCAT, the scores, the thresholds, the decile ranges will change every year depending on how well everyone does. So, for example, if you go on our website or any medical dental school's websites, they will have previous year's grades, and also the UCAT has the last few years grades and decile ranges. So that should give you a rough idea of how well you've done. And just for graduate entry, as I know some of you might be interested in applying through the graduate entry route. So we also use a 50-50 weighting for the kind of academic and UCAT scores. So for the academic side of things, it's for your first degree, and degrees are divided into 3 categories. So you've got the biosciences degrees, which do contain sufficient biology and chemistry. So you wouldn't need any A-levels, any specific A-level kind of entry requirements, because you've done that level of biology and chemistry in your degree. 2, the science degrees, which lack biology or chemistry. So if that is the case, you would have to have a minimum of AS or A-level, grade C for biology and or chemistry. It depends on what is missing in your degree. And 3, non-science degrees. So if you've completed a non-science degree, you must have a minimum B grade A or AS level in chemistry or biology, plus one other science also at grade B. So you need to have completed your degree in the natural length intended for qualification. So that's normally 3 years or 4 years if you have taken an undergraduate degree and then completed an integrated master's. And you need to have got a 2-1 or equivalent in the subject. And we do not consider master's or PhD qualifications as part of the academic scoring. We're just going on your first degree. I should also say, if you go online to our web pages, on the graduate entry web pages, it has what we call a title degree checker, where you can check the degree that you are taking at the moment, and whether you do need any additional qualifications, such as an A or AS level. The information is on our website, and you'll be able to check your degree and whether you need to do anything else. So in terms of the UCAS deadline process, the deadline is the 15th of October, not the January deadline that all the other subjects have. Every year there's at least a handful of people that don't realise that and email us after that deadline. So just don't be one of those people. You get 4 UCAS choices for medicine or for dentistry, and you have that extra option for an alternative course, should you wish to include an alternative. Also have a look on universities' websites to find out if you are eligible for any contextual offers. Lots of universities will have these contextual offers. Some, it might be for students that are on particular programs. So whether that's kind of widening participation pathway programs, whether it is national programs such as Realising Opportunities or summer schools, or it could be that students from certain backgrounds are eligible for contextual offers. So have a look at that. You will also need to complete a personal statement and a teacher's reference. So it's important that you're a good student and you demonstrate that to your teachers, because remember, they'll be writing a reference. So just to recap about your strategy. So just think about the university's location, the structure of the course, the grades that you are predicted, or the grades that you get if you've already got your grades. Think about your UCAT and BMAT scores. Look at how universities use all these entry requirements. Research any contextual offers or widening participation programs. So there will be lots of activity taking place over the summer, whether it's not guest lecture, whether it's like taster lectures, whether it's summer schools. There might even be opportunities going through into the autumn that are available. So have a look for these and be strategic with selecting the universities you're likely to receive an offer for. I'm just going to cover some other things that you can consider. That should help you with your application. So what else are medical or dental schools looking for? We want to see our students demonstrate that they have a good understanding of the core values and attributes that we're looking for in our doctors and dentists. So there's lots and lots of these. I've just put some examples on the screen. But we want to see you have a knowledge of them, be able to demonstrate themselves, also be able to kind of talk about examples of these. And this is the sort of thing that you can include in your personal statement, and you will certainly be marked on and asked about in your interviews or your MMIs that you might have at other universities. We also want to see that you've got an understanding of the realities of the profession. Lots of people like the idea of being a doctor or a dentist, but they perhaps don't appreciate the dedication, the long hours, the kind of harder side of things that you might not necessarily be aware of. So we want to see you have an understanding of these. The commitment to the subject, again, this is something that will come out in your interviews, in your personal statements, with the sorts of examples that you talk about, what you might have done, what you might have read. Again, this is similar for your self-motivation and confidence as well. This is kind of big question, especially in the past year. So work experience, shadowing, volunteering. So when you read about work experience, people talk about work experience, we also mean shadowing and volunteering as well. This is something that is a requirement. Even at this even at this moment, because it helps you demonstrate an understanding of the realities and skills and attributes that I've just mentioned. Any healthcare experience is valuable. It doesn't have to be in a hospital, with a private dental practice, with a GP. It could be any kind of healthcare setting, whether that's sort of shadowing or volunteering in your local community, in a care home. We do realise it is likely to be difficult this year, but there's online work experiences that are available. So Brighton and Sussex Medical School and Royal College of GPs Observe GP program are two experiences that you can do right away. So you should have at least some experience, and this is absolutely fine. We've had I was doing some on the interview panels for some the medical and dental interviews. People talked about these online work experience opportunities, and they were fantastic. So it really doesn't matter if you only get online work experience. Like I said, there might be opportunities volunteering in your local community. Also think about what you might have done over the past year to support your local community, your neighbours, your family. What has that told you about healthcare? What sorts of things did you have to do? What skills were you using that you could link to being a doctor or a dentist? You could also improve your understanding by researching current issues. So there's lots of really good places to improve your understanding. I'm just going to go through some examples in a second. Medical Schools Council Studying Medicine web pages is a really good place to start for giving you some tips about all these kinds of things. Self-reflection is key to all of this. We want to know, as I said, it's all about your understanding. So it's not a case of getting the most amount of work experience, reading the most amount of books, articles. We want you to self-reflect. It's all about the quality, not the quantity. So what have you learned about the realities, about the skills, etc. So I mentioned this already, just to pick up, I'll talk about healthcare professionals. Just remember that doctors and dentists don't work alone. So do when you're doing your sort of further research or work experience, look at what other healthcare professionals are doing and how they're interacting with doctors and dentists. Again, self-reflection is key. Sources that you can draw upon. So there's newspaper articles, websites, news channels, podcasts, documentaries and films. So we're looking for documentaries and films, not Holby City and Casualty, just to let you know. Books, there's been all sorts of books written about medicine, about dentistry, about healthcare. So you can read some books. Google Scholar PubMed. There's journals. I'll put some example journals up there. So just some things to consider. I've just got the last couple of minutes before I finish. So look for a variety of sources. Don't just read one paper. Read a variety of papers, even if you don't agree with the kind of political leanings of that newspaper. You want to have a really good understanding of a variety of opinions. You can consider the purpose, motivation of the sources. What else is talked about? What are you learning about the professions? Again, what skills, attributes are needed, and examples. So when you're reading, when you're kind of doing this further research, note down examples that you can draw upon in your personal statement or at any interview at a later date. And try and practice articulating these to other people. It's not always easy talking to other people. It's a skill, and it's a crucial skill when you become a doctor or a dentist, and certainly a medical and dental student. But it's a good way to practice. Preparing for this is to speak about all these things that you're learning to someone else. So whether that's a peer, a friend, family member, neighbor, anyone that will listen. Some other useful sources to you just up on the screen. personal statements. Essentially, we want to find out why you're interested in studying medicine or dentistry. What have you done? Whether it's further reading, work experience, volunteering, shadowing, what you've learned from that, about the profession, the skills, the attributes, why you're suited to being a doctor or a dentist. There'll be different types of interviews, and this is something that you can start to think about when you get into year 13, but everything that you're doing at the moment is helping you to prepare for this stage, because you will have to demonstrate all these skills and understandings as well. And it is a level playing field, so that it's all about how well you perform on the interview day or the MMI scenarios. But I'm sure this is something that will be covered in the future at a SAMDA event in the autumn. Finals, couple of slides. Think about alternative options. Again, we've already talked about that. There's loads of different careers that you can have an impact on someone's life, an impact on society, and pursue a passion for science. Or even if you suddenly completely change your mind, as we've heard, you can do something that's completely different as well. And here's just some examples of sort of related programs at Queen Mary. And just be prepared, do everything that you need to do, and you stand a really good chance of getting in. Thank you very much for listening. I hope you found that useful, and I think there might be some time for questions.
Yes, thank you very much. We do have a few questions from the students. So the first one that I have here is, how important are GCSE requirements compared to A-level requirements?
This will depend on the university. So for us, it's just something that you need to have. You just have to meet those. They don't count towards the academic requirement. It's just something that you just need to have, and it's like a tick to say, yeah, okay, this person has it. Yeah.
Yep, that's fair enough. Thank you. The next question, you have covered it a little bit, but just to reiterate, is non-clinical work experience valid?
Yeah, absolutely. Absolutely. So, like I said, any sort of work experience, try to get it in a health-related setting. So even if it's, like I said, in a care home, but even if you have a part-time job, this is something that you can draw upon. You might be working in a supermarket, for example. So, you might have to deal with difficult customers. You might have, have to communicate to all sorts of different people, just like doctors would need to do in dentists.
Yeah, definitely. There's a lot more compassion for the fact that during the pandemic it's very hard to get clinical work experience, but hopefully you found that a bit reassuring, that non-clinical work experience is also valid.
Yeah.
We will move on to our last question.
Okay, when is it a good time to contact universities to ask for application advice?
Anytime, really. So I think if universities have all sorts of programs, all sorts of activities taking place. So whether that is student societies like SAMDA, for example, running events, or whether it's actually university run events, so open days, it could be summer schools, it could be taster sessions, pathway programs. These will take place sort of throughout the year. If you want to know information about entry requirements, like how the application process for a particular university, the first place to call is looking on the actual university's web pages. Will have all the detailed information about what is expected of you, and then after that, have a look for other events that might be available. If you have any questions that aren't covered on the university's webpage, then do get in touch with universities directly. There'll be contact details. Also, for example, we have something called UniBuddy, and lots of universities have this as well. So we have students that are what we call UniBuddy students that are studying medicine and dentistry, and you can get in touch with them via our UniBuddy platform on our website, and you can ask them questions. It's a safe way to find out more about what it's like studying, and they're actually real people as well, not robots. But you should be able to find information out all year round, but it will just depend on what's going on, depending on the time of year.
Okay, that's useful to know about that resource. Thank you very much for your presentation. It was very comprehensive. I think our students definitely are going to be able to learn a lot, gain a lot from that. So thank you very much for your time.
No problem.
Yeah, I would just quickly say, I know that there are a lot of questions that were submitted to us, so we will continue answering those questions over the course of the next week. Also, if you did have any further questions that you didn't quite submit, you can either pop us a DM on Instagram or send us an email. Both the information you can see down below. So our Instagram is Barts_SAMDA, and our email is samda@bartslondon.com. All of us are more than happy to answer any questions. We're happy to pass it on to a specific clinician that's spoken today if you would like as well. Mm-hmm. All right, so now we're going to move on. I'd like to hand over to our staff president, Dr. Robson, just to share some closing remarks with us.
Thank you, and I hope that everybody has found this useful and that there is something that you've learned that you didn't know before. And I just want to kind of repeat again that if you have any questions, if you've got any queries, put them into the chat and the girls will pass it on to me if there's anything specific that you want to know. If you feel that you've got a specific question or a burning question about medicine, about whether it's the right choice for you, that's what SAMDA's here for, and what I'm here for is that if you really want to do it, then do it. That there is nothing like it. Same for dentistry as well. If you like working with people, if you like communicating with people, and you like thinking laterally and putting a puzzle together, then medicine is a great profession. Medicine as a course is long, and it's not like any other course. It's not classified. So when you get your MBBS or equivalent, it's not graded. It's everybody from the person who gets 80 or 90% on their finals to somebody who gets 50% on their finals is still called doctor when they graduate. Because what you are saying by passing is that you are competent to be out there, but that doesn't mean that you stop learning. You continue to learn, and if lifelong learning and wanting to improve yourself is something that appeals, and having a challenge and not knowing what is going to happen in the day, you don't know who's going to turn up, what they're going to present with, then medicine is inspiring and great. But you don't need to be academically brilliant. Some of the best doctors I know were the people who got that 51%, that 52%, who passed, but they were able to balance the work life better than anyone else. But also they were able to marry the science with that human side and to put it together so that they were able to get the relevant information from their patients, that they were able to use the knowledge that they had for the benefit of their patients. And so if this is something that interests you, explore it. It doesn't matter which university you go to, but Barts, the SAMDA, myself, the other staff that you've heard tonight will help you, even if you don't apply to us. We will help you with your personal statements, with mock interviews to prepare you for whichever medical school you decide you want to go and spend the next 4 to 6 years at. And I think I've spoken enough. I think that's enough for now. But I hope to see some of you in person at some point.
Definitely, hopefully in September.
In September.
Thank you very much, Dr. Robson. We will now move on to closing up the event. Thank you.
Okay, and that concludes this evening's event. We'd like to give a huge thank you to all of our guest speakers this evening for their amazing talks. And we'd also like to thank all of you for attending. We hope you've enjoyed yourselves and that you've gained some useful insight into medicine and dentistry, both at the degree level and at the career level.
Yeah, okay, so now moving on to certificates. If you scan the QR code or alternatively type out the box link, you'll be taken to the feedback form. It's really important because it helps us know how we can help you as best as we can. So yeah, once you submit it, you will be emailed your certificate. You'll also be emailed the SAMDA application guide and also a Google form so you can sign up for our future mailing list so you never miss out, and also a funding summary for 2021 entry. So the feedback form will close on Thursday at 10 p.m. So that means you'll only be issued certificates until then. On that same day, the personal statement prize draw will also be ending. So make sure you sign up. It is a brilliant opportunity. As Dr. Robson said, we are here to help you. And this is just an example of one of the resources that you can really get involved with.
Yeah, our social media and email is on the slide. Please do also subscribe to our YouTube channel. We have so many more events planned for this summer. And we also have the recordings from the events that we've done earlier on in the year, so you can refer back to UCAS work experience. There's a lot of resources on the YouTube channel, so please subscribe.
Yeah, exactly. So with that, we will conclude the event. So enjoy the rest of your evening. Hope you all stay safe and well. Until next time, goodbye.
Bye.